Mr. Keith.
Good morning. May I please call Lord O'Donnell?
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Could I commence, please, by asking you to give your full name?
Gus O'Donnell.
Lord O'Donnell, whilst you give evidence, could you remember, please, to keep your voice up and also try to speak as slowly and as concisely as you're capable of doing in order that your evidence may be more easily recorded by our stenographer. Lord O'Donnell, you have been good enough to provide to the inquiry a witness statement dated the 26th of June 2023, INQ 548. There we have it. Is that a statement that you signed and declared to be true to the best of your knowledge and belief? I think on the last page, page 16.
Yes.
Probably on the 26th of June. There we are. Lord O'Donnell, significantly, you were once upon a time the Cabinet Secretary. And in order to be able to get our bearings, were you Cabinet Secretary between 2005 and 2011? Were your successors, then Sir Jeremy, later Lord Hayward, who tragically became very ill whilst still in office and died? He was succeeded by then Sir Mark, later Lord Sedwill, between 2018 and 2020. He resigned in September of 2020, and he was replaced by the present incumbent, Simon Case. Have we got the chronology right?
That is correct, yes.
Did you leave the civil service in 2011 when you ceased being Cabinet Secretary?
Yes.
You're now a crossbench member of the House of Lords. Do you carry out a number of different functions and have a number of roles, including being chair of Frontier Economics? You're the president of the Council of Fiscal Studies, chair of the Public Interest Board of PwC, and are you also a chair of a number of worthy establishments and groups and entities, including the All-Party Parliamentary Group on Wellbeing?
Yes, for a full list, you should look at my House of Lords register. For example, I finished being chair of the Public Interest Board at PwC some time ago. But there's a full list, including, as you rightly say, the fact that I chair Pro Bono Economics, which may be relevant later.
Yes, indeed. And have you, since the commencement of the pandemic, in fact, published a number of articles concerning the government's response to the pandemic, including an article based upon an annual lecture that you gave to the Institute of Fiscal Studies in September of 2023? I'm not sure, actually, perhaps that's the right date. But in any event, you gave a lecture to the IFS, and that lecture was subsequently produced and reproduced in an article entitled The COVID Tragedy, Following the Science or the Sciences. You also published an article entitled Far From Well, the United Kingdom Since COVID-19 and Learning to Follow the Science, an article you published with a professor or an academic at, I think, King's College London, Harry Begg. And also, thirdly, an article, When to Release the Lockdown, a Wellbeing Framework for Analysing Costs and Benefits. So you have looked, in broad terms, quite carefully at some aspects of the government's response to the pandemic, and you've published your thoughts in relation thereto.
Yes, I should explain that as president of the Institute of Fiscal Studies, we were due to have a Nobel laureate come and give the lecture. It was COVID, so they didn't come across from the States, so I stepped in at relatively short notice and produced that lecture, which was then turned into an article with Harry Begg, who I fear is not King's College, but is Blavatnik School at Oxford University. And I should say, one of the reasons for this, and the point I wanted to get across very early, is that this was a really serious event and a massive thing for government. And I just wanted to make my personal view that I feel very strongly for all those affected by it, by the victims of this. As an individual, I was affected by it as well, of course. So I just want to say that I feel for you and I understand where you're coming from. And I think it's really important that this inquiry works, as you are, incredibly hard to learn lessons from the events.
In your articles, one very important theme emerges, and it may be put in this way, Lord O'Donnell. You pose the question, were the appropriate structures in place to ensure that the best possible decisions were made? And I'd like to commence, please, with an examination of that question. Why does it matter when government is making momentous decisions of this type, that the structures and the processes which underpin that decision-making are appropriate, adequate, suitable, worthy unto the day?
So what's important when you hit a crisis is the ability to bring together all of the information in a sensible way to get that to the ultimate decision makers, who are, of course, ministers, in a form in which they can understand and apply their judgment to that information and evidence that you've given to them. So you do need to do this, and it's also important that quite a lot of people fight the last war. So some of the structures were set up in a sense with regard to the previous crisis. So in my case, I lived through SARS and things like that. So there was an element of us thinking about pandemic flu. A lot of the time that was the top of the National Risk Register, which was started in my day. But each crisis is very different. If you think about, for me, the biggest crisis during my time was the global financial crisis. That was very much about the economy, the treasury, global issues. So that required a certain set of structures. COVID was different in that quite often, for example, SARS was mostly a health crisis dealt with through health means. So, for example, you were thinking about how much of the medicine should we buy, and we were criticised later for buying too much. Actually, I think, my goodness, I think we maybe, I personally would stand by all the decisions we made then. But COVID was different in the sense that there were going to be medical ways of solving this, vaccines eventually, there were drugs, there was various things, but also there were, I think the term that everybody uses is MPIs, which were very different and actually required understanding of how people's behavior would change and also of their impact in a broader sense. So, for example, closing schools would have an effect on transmission, which experts in epidemiology could tell you something about. But in order to understand the overall impact and put this to ministers, you needed to have someone saying, what's the impact on that on the children, on their education? What's the impact on teachers? What's the impact on the mental health of the parents? And in due course, on the economy as a whole. So there were lots of, I refer to it in the papers as a mixed crisis, in the sense that it starts with a health issue, but it's solved by a combination of health and non-health interventions. And that's complicated. And therefore, you need a multidisciplinary approach right from the start. Hence, you need to set up the structures to deal with the crisis you're dealing with. So what would have been right for a global financial crisis would absolutely not have been right for COVID.
The type of evidence and information to which you refer was, of course, during the pandemic, the sort of information relayed to decision makers through, as we know, SAGE, and we'll come back to that in a moment, and COBRA, to which we'll also revert in a moment. But presumably, at some point in this structure, in this system, the information, the evidence, the wherewithal to be able to enable decision makers to make the best possible decisions had to be routed through existing government structures. So the Cabinet Secretary, the Cabinet Office, Number 10, and perhaps to a lesser degree, the extent to which it was a lesser degree, we'll examine in due course, the Cabinet. How important in this decision-making process or this evidence-gathering process is the role of the Cabinet Secretary?
Very important, but I would say one thing about you don't necessarily need to put it through existing structures. You can create new structures.
Of course.
And we did for things like the global financial crisis.
But I'm asking you about the existing structures because the Cabinet Secretary played a vital role, of course, in the response to the COVID pandemic.
Absolutely. And if you think about what the role of the Cabinet Secretary is in this, is to make sure that both the Prime Minister and Cabinet, and I think this is important, it's actually in the name. If you're Cabinet Secretary, you have dual roles, right? You are there as a policy advisor to the Prime Minister, but you are also there to support Cabinet and Cabinet decision-making. So you have to try and set up structures that make sure that both of those, as it were, clients are treated properly. And you need to make sure that the structures you've got work well for this. So, for example, COBRA was used at various times. COBRA is a structure that works at its best. Sorry,
we're going to come on to COBRA in a moment.
Okay.
Can we remain focused on the Cabinet Secretary
Sure.
for a moment? The Cabinet Secretary is in effect, is he or she not the head of the government machine? They liaise with the Prime Minister, to whom, of course, they are the Cabinet Secretary. He or she will be the head of the civil service, probably, not necessarily. They liaise with the Cabinet, they are the Secretary to the Cabinet, and they are at the head of the structure, the civil service structure, which will give advice to the Prime Minister. Is that a fair summary?
Yes. I would stress, though, it's Prime Minister and Cabinet. And sometimes you're going to talk to the Prime Minister about ways of involving Cabinet more. So, you know, it's not just one way. You have two masters in that sense, and you are, as you absolutely rightly say, head of the civil service. So all of the permanent secretaries to the different departments report to you as Cabinet Secretary. So you are trying to make sure that all of the departments work well together, particularly when you've got an issue which goes across departmental boundaries, and COVID would be one where that absolutely was true.
And so in a time of crisis, the demands on the Cabinet Secretary are greater than in normal times because they have to try to broker the position within government as well as respond to and be at the, I suppose, the top of the pile in relation to the government's ability to deal with the incipient crisis.
So, yes, I would say so, but I would also say that as Cabinet Secretary, I was told there was a crisis every single day, and that turned out to be there was a bad headline in a newspaper. My response always was, how many people have died? And you need to get that calibration in there to understand that some crises are really, really important and need urgent attention. I think COVID was a classic example of that. So there is this kind of role of the Cabinet Secretary to get things in perspective, to say, you might think this is a crisis, but this is going to be something that will be resolved in a few days. It might be a few bad headlines. This is something that's absolutely existential threat and therefore requires everybody to change their behavior. It might require new structures, and it might require all of us to think about things quite urgently as to what we need. For example, collecting more data.
Is the Cabinet Secretary the head of the Cabinet Office, which is itself a government department, although perhaps to call it a government department maybe to mislead indirectly?
Good question. So when I was Cabinet Secretary, I actually did have three roles. At the time I was Cabinet Secretary, head of the Civil Service, and I was Permanent Secretary of the Cabinet Office, which I thought was too many, and I wanted to get there to be a separate Permanent Secretary of the Cabinet Office. But ultimately, you are always going to be overseeing the Cabinet Office, whether you've got the titular head of Permanent Secretary of the Cabinet Office or not, because that is the mechanism by which you're bringing together all of the departments. You are, as Cabinet Secretary, it's worth pointing out, every Wednesday for an hour, you bring together all the heads of the government departments, all the agency heads, and you talk about the big issues of government. And you do this knowing that Cabinet will be meeting to talk about some of the same issues. So there is a very big role in bringing together the whole of the civil service and government machine.
How important is the interface between the Cabinet Office, which performs this wider governmental role of broking between departments, of trying to apply a level of control, to try to focus the information and the evidence in a way that assists the centre of government, and number 10, where executive power in the form of the Prime Minister is essentially vested?
So you have to manage both, and you have to remind the Prime Minister at times that he may be, phrase used, primus inter pares, first amongst equals, but he is head of a cabinet. And it's important that Cabinet gets to discuss some of the important issues. So the Cabinet Secretary will spend quite a lot of time with the Prime Minister saying, actually, Prime Minister, you should take this to Cabinet, or you should take this to a certain committee or whatever, rather than just saying, Prime Minister, you've got to decide this or that.
It's self-evident, isn't it, that these working relationships, the relationship between the Cabinet Secretary and the Cabinet Office and the Cabinet, and the relationship between the Cabinet Secretary and the Prime Minister, and between the Cabinet Office and number 10, are all absolutely essential to the way in which a government can respond to a crisis. If those relationships break down or become degraded, the government is likely to respond less efficiently and less well. Would you agree with that general proposition?
These are all personal relationships, and it's, having worked closely with John Major, Tony Blair, Gordon Brown, David Cameron, Nick Clegg, I would say in every single respect, you have to take into account the personality and strengths and weaknesses of the Prime Minister you're dealing with. And therefore, as Cabinet Secretary, you have to adjust to that because they are the Prime Minister, and you need to make the relationship work. So different styles are needed at different times depending upon who you're working with. But yes, at its best, that relationship is a very strong and close one and allows the Cabinet Secretary to do what we always say, speak truth unto power, and to be able to challenge the Prime Minister and say, no, Prime Minister, actually, I think you're wrong. I think you shouldn't do this, you should do that.
And you say at best, but if at worst the relationship breaks down or is a loss of confidence, that is likely, is it not, to have a deleterious, a damaging effect on the nature of the decisions which the government will then make.
Yes, I mean, there's no doubt that if that, in my time, I can only speak about my time, in my time, if I had not felt that there was mutual trust and respect between me as Cabinet Secretary and the Prime Minister, that would have made life very difficult. And I was very fortunate in that all of the Prime Ministers I worked with, I felt that relationship existed.
It is now well known that Sir Patrick Vallance, then the government's chief scientific advisor, kept a set of diaries or evening notes in which he recorded his contemporaneous views on the workings of government during the crisis. In those diaries, in fact, on the 11th of November 2020, he says this of your successor, Cabinet Secretary Simon Case. Simon Case says, number 10, at war with itself. A Carry faction with Gove and another with SPADs. What are SPADs?
Special advisors, political appointees, not civil servants.
PM caught in the middle. He has spoken to all his predecessors as Cabinet Secretary, and no one has seen anything like it. Lord O'Donnell, were you one of the predecessors to whom he spoke?
Most certainly I was, yes. And like I say, I look back on this and think I was blessed. I actually had a relatively easy time. All of the Prime Ministers I worked with, like I say, I think there was that sense of mutual trust and respect and ability to get Prime Ministers to focus on the decisions they needed to make and the information and evidence they needed. That was clearly from the evidence you're seeing. Obviously, I wasn't anywhere near this at the time, but from the evidence you've got from other people, that was clearly an issue. And once that's an issue, the reason that the Cabinet Secretary Simon Case would have been talking to Patrick Vallance about this is they need to understand how to operate in a way in which the top is not functioning as well as you would like it to. And when that's happening, you obviously need to think about how do we ensure that the best decisions are made for the country when it's not working as well as one would like. And that means that sometimes you have to be clear with the key officials like Patrick Vallance, Chris Whitty, that there are problems with these relationships and therefore things may not happen as quickly as you would like. So that's the world you're living in. They are there. You can't change them. A lot of these issues are for, our political appointees, and the Cabinet Secretary can't do anything about that.
But the outcome, the ultimate outcome of a failure to take a grip on factional infighting or loss of confidence in important individuals or breakdown in the relationships of trust between these various departments and the various individuals will be, won't it, a degradation in the decision making. No government sensibly constituted can respond properly to a crisis and make these momentous decisions if it is at war with itself and if its various moving parts are bluntly dysfunctional.
There are always differences of view amongst members of cabinet and differences of view even within number 10. So, and that, to be honest, is healthy. You would not want groupthink to take over. There are always competing factions. There are always competing views of looking at the same evidence, coming up with different answers. The job is to try and make sure that there is a consistent framework, that there are rational decisions being made, rational in the logical sense, that can be explained consistently both to within government but also to the public to understand why certain decisions are made. So I think that's the key. You have to accept the fact that there won't be unanimity amongst all of these different players, but you need, as best you can, to use the processes at your disposal to make sure that all of these different voices are heard, but there is a good decision-making process that comes up with the right answers.
This material, Lord O'Donnell, though, goes beyond, doesn't it, debate or even ferocious debate. It indicates a level of dysfunctionality. No one has ever seen anything like it. There are references to chaos, to internecine warfare going on within number 10. That's not the normal part of government, is it? That's not debate. That's a systemic failing, is it not?
Like I say, I wasn't there. All I can say is during the time when I was there was healthy debate. There's a lot of people who have written about Tony Blair and Gordon Brown not always sharing the same views. That actually, to my mind, was a strength of government, a chancellor and a prime minister testing out ideas with each other. But yes, I wasn't, and I don't think anyone has ever said that there were problems like those that Patrick Vallance is referring to and others have mentioned. So that, to my mind, means that Simon Case was dealing with a far, far more difficult situation than I ever had to face.
It's a matter of public record that Lord Sedwell left the position, gave up the position of being Cabinet Secretary publicly in September of 2020, although the debate in Downing Street as to how long he should continue for raged throughout the summer. What, in your experience, would have been the likely impact on the decision-making processes of the change in Cabinet Secretary in those terrible months?
Well, on the one hand, you want a Cabinet Secretary that can manage the relationships with the Prime Minister. And if that relationship's broken down, it's a bit like, as Cabinet Secretary, it was always my job to go and talk to a minister if they weren't getting on with their Permanent Secretary and to think about, was it something about the way the Permanent Secretary was acting or behaving? Was there some personality clash or whatever? And you try and find a way to make that relationship work better and to then think about, ultimately, if it wasn't going to work, how you managed a smooth transition. So in a sense, that would be my playbook as to how. Unfortunately, that playbook works when you're talking about ministers and permanent secretaries, obviously when it comes to the Prime Minister and the Cabinet Secretary, there's no one else to go to. So that's a very difficult situation. And if a Cabinet Secretary and a Prime Minister ultimately can't work together, and, you know, from what we've heard about the Prime Minister's style and what other witnesses have said, I can understand why that might be very, very difficult. Then you can understand why there's a decision for that Cabinet Secretary to go and for a new one to come in. I mean, of course, the other side of it is when Prime Ministers should go, and that's obviously an issue that's either decided by the electorate or their own party. That was done.
You've used the phrase, perhaps the euphemism, it would be a difficult situation. In terms of government administration and the proper workings of this, the very highest level of government, that breakdown of relationship with the Prime Minister and the Cabinet Secretary was frankly a car crash, wasn't it?
Well, you have to do your best to make sure that it's not.
But it was it not? It does appear that the relationship broke down completely at the highest level of government. And that is a most regrettable feature of the way in which the government responded.
It's most certainly, yes. I mean, I would say it would be far better if they were getting on well. Precisely, you know, the job then of the Cabinet Secretary, Mark Sedwell, would have been to try and make sure that the damage of that relationship not working was as small as possible.
Indeed.
And, you know, so Mark needs to think about, okay, what's the future? Can we get a new Cabinet Secretary in? Can we make sure that this doesn't damage things in the way that you're right? Because the Cabinet Secretary is a very important position for bringing all of this together at a particularly difficult time. So the potential is there. The job that Mark tried to do was to make sure that the damage was as small as possible, given the behaviour of other participants in it.
Generically, there is, of course, the well-known division of function between the civil service, which acts primarily in an advisory role, and ministers, who carry executive power, who are the decision makers. But without delving too far into this extremely complex conceptual and administrative divide, does that division of function work particularly well in a crisis where you have civil servants giving, with the best intentions of the world, advice, but leaving it to ministers, some of whom may have more experience than others, to make the executive decisions?
In a sense, that's democracy for you. You know, we've decided that we want to go down a route where the ultimate decision makers are elected politicians, mostly. I mean, there can be some from the House of Lords, obviously. And they can move around. You know, during my time, I had 9 ministers of pensions in 5 years. I mean, it's quite a long-term issue. So you would want your decision makers to be really good at one thing. You can't expect them to be good at the subject matter in the sense of, you know, because they could move from health to defence or whatever. What you really want is for them to be good at decision-making under uncertainty, because you're always going to have uncertainty. You always want them to, and I would, you know, if I had one wish, it would be that ministers had training in decision-making under uncertainty, because that's the nature of what they do. And this is, particularly in COVID, it's complicated. The stats you're giving them, you know, the whole, you know, epidemiological modelling. There are some of us who, you know, who I grew up teaching how to do modelling, you know, but that's not their background for most of them. So this is hard for them, and it's hard for us to explain complicated things to people who haven't done basic stats and understanding probabilities and the uncertainties around these things, because to be honest, dealing with COVID, you are mostly dealing with situations where the honest answer most of the time is we don't know. But, and this is a really important but, we know ways to try and find out, which mostly involved collecting more data early.
Just picking apart some aspects of that answer, Lord O'Donnell. Firstly, in terms of crisis management, is there any training for ministers at all in advance of taking up their role, their position, in order to better prepare them for crisis management?
Well, obviously, there are training programs. People like the Institute for Government, Blavatnik School, do training programs for would-be ministers, and they will cover things like crisis management. You get good training for them if they do tabletop exercises. So they have to live it, and I found that was one of the most important things. Also, you'll find that ministers get better on their second crisis. So when they go through it the first time and they understand how COBRA works and issues like that, they get better. I think all of us would say, the second time we do something is so much better than the first time.
That may provide little solace for the poor unfortunates who suffer from the first crisis.
Absolutely, which is why when it comes to a new kind of crisis, like I say, I call this a mixed crisis, where you're very aware that you're putting to people really complicated issues that they will find very difficult. Hence, the importance of having people like the Chief Scientific Advisor, the Chief Medical Officer, to try and distill the wisdom of others and put that evidence to ministers in a way that they can understand it and allow themselves to apply, which ultimately they have to, as the elected ministers, their decision-making process to it.
The second aspect of your earlier answer referred to or related to churn. In your article, Far From Well, you note that Mr. Johnson's cabinet went into this crisis with comparatively limited experience in positions of power. You said there had also been significant churn among the top positions in the civil service. And plainly, therefore, those ministers had not had any opportunity to take part in live planning exercises. To what extent do you believe that comparative lack of experience in ministers had an impact on the decision-making in the early days of 2020?
Well, I should say that you can't control this to start off with. You imagine 1997, Tony Blair comes into office. Tony Blair had never, ever had a ministerial role. He becomes Prime Minister, right? Very, very few ministers, when there's a change of administration, have had any experience whatsoever. So this is something you have to live with in a democracy.
Can I pause you there,
Yeah.
Lord O'Donnell? Your article was entitled Far From Well and was a piece of learning on the relative performance of the United Kingdom government and its decision-making. You wouldn't have referred on page 785 to the significant churn amongst ministers and civil servants unless you'd taken the view that it mattered, and it had an effect on the standard of decision-making.
Sure, don't get me wrong. What I'm saying is it does matter, but it's not within your control. If there's just been an election, imagine the next election. Imagine if there's a change of administration. By my count, there will be 7 people in government, if the shadow cabinet became the government, who've actually had any ministerial experience. Right? That's the world we live in. You can't assume that ministers have got prior experience. So here we are in a government where there hasn't been a change of administration for a long time.
Sorry, can I just ask you to slow down just a little bit for our stenographer?
Yes.
Lord O'Donnell, thank you.
What I'm saying is that so you have to have systems that will work with ministers that are new in place.
Will ameliorate, in effect, the lack of ministerial experience.
Precisely. In an ideal world, and I remember saying this to David Cameron when I had the access talks with him, when he was leader of the opposition, he asked me, what's the one thing I could give you, Gus? And I said, minimise the churn in ministers. The longer ministers are in place, the more chance they'll have the training, the more chance they'll have been through one of these issues. So I think it is absolutely vital. And our ability to respond, and I would say any democracy's ability to respond, will depend to some extent on the experience of ministers. And if ministers, even though they haven't been through a crisis like this, have had training about how to manage crises, that would be even better. So I would love them all to have pre-ministerial training.
I think you might describe yourself fairly as being in the Sir Oliver Letwin camp in that case.
He would be a perfect minister in many respects because he did take these things seriously.
Thirdly, arising out of your earlier answer, a lack of ministerial experience places an even greater premium, does it not, upon the receipt of straightforward, clear and speedy advice from the civil servants.
Yes.
One of Sir Patrick Vallance's diary entries from December 2020 says this, that a permanent secretary had become annoyed that the chief medical officer and the chief scientific advisor had told the Prime Minister about a new variant. And he says, sounds familiar. Really, we had no choice and he needs to know. The civil service reflex to slowly manage politicians is really awful. Does it follow that if there is a lack of ministerial experience, then any level of dysfunctionality in the civil service, in number 10 or the Cabinet Office, in terms of informing ministers, informing the Prime Minister, providing them with the right information, the right evidence, will have an extreme, perhaps a disproportionate impact on the ability of those ministers to make proper decisions. Without the experience and without the proper flow of information and advice in the civil service, those ministers will be, frankly, at sea.
So, yes, they need the proper advice, but this comes back to my point about working as well as possible with the ministers you've got. So if you know you've got a minister that is liable to, on being told there's a new variant, to immediately jump to a policy conclusion which you think may be wildly mistaken, then it actually makes sense to pause for a second and say, okay, so if we say there's this new variant and it's much more powerful, we really need to be able to answer the Prime Minister's question afterwards, which is, so what should I do about that? So you might want to hold back and say, let's do some analysis first. Let's make sure that we've considered various policy options and put before the Prime Minister these various things, because otherwise there's a chance the Prime Minister will come to a snap decision when told about it and will then talk to somebody else who will say, yes, but there's a case for doing the opposite. So you really need to work with what you've got in terms of ministers, and you need to understand how the machine can help those ministers make the right decisions, which may well often mean that you pause for a second before you actually give them some new piece of data.
And this machine was stuttering, was it not?
Well, I'm not sure I could vouch for that. I would say the machine was doing what it could in terms of understanding the virus and all the rest of it and bringing together the evidence in the best way it could. The question of whether it was stuttering at that point or at the point where it hits the minister is not something I could say because I wasn't there.
I understand. Just focusing now on the Cabinet Office generally for a bit. A considerable amount of evidence appears to show that systemically the Cabinet Office failed to exercise the sort of institutional levers of power that are required to be operated in order to bring other departments into line, to be able to broker different positions between different departments, and to synthesize the information, the evidence, and the decision-making for ministers. During your tenure, was any concern ever expressed that the Cabinet Office was too amorphous, that it had too many moving parts, yet had insufficient control over the rest of central government?
There is, I would say, throughout my career, long career in the civil service, there have always been different views about this. That on the one hand, if you talk to departments, they will tell you that the Cabinet Office gets in the way too much, that they are slowing us down, and on the other hand, the Cabinet Office will say that they need to join up more and more. I mean, to give you one little example, one incredibly effective way of getting government departments to work together was when you present them with a problem, which they have to answer quickly. A classic would be there's an EU directive on X. It affects 5 different departments. There's going to be an EU Council meeting in a week's time. We need a single government position. Alas, that doesn't happen anymore. And quite often you'll find, therefore, that departments are basically not resolving that, not coming up with a single thing. So this cross-departmental aspect is very difficult to do in our system. And that's where you need the structures to work effectively. And I would say one of the most effective ones in my time was the setting up of the National Security Council.
Just pause there, though. It's axiomatic, is it not, that if the system is not working, if the Cabinet Office is unable to exercise sufficient levels of control over other departments, and if there is an institutional war going on as to who ultimately has the whip hand, whether it's number 10 or whether it's the Cabinet Office and the Civil Contingency Secretariat or the Lead Government Department, in a time of crisis, that level of lack of cooperation or lack of proper exercise of power will be all the more exemplified.
Well, ultimately we know, and departments know, that it's for Cabinet and the Prime Minister to make decisions. So when it's something which crosses departmental boundaries, you want, as far as possible, to set up machinery of government, various committees that cross these boundaries, which actually allow you to bring everybody together. But it's, you shouldn't, the realpolitik of this is that there's always a battle going on between central control and individual Secretary of State's freedom to do what they want. It's never, that's never that easy.
Now, you refer then to the bodies and the organisations which can exercise power in times of crisis. It's very plain, and of course it's a matter of public record, that the institution known as COBRA, the Cabinet Office Briefing Room structure, was set up, of course, and convened to deal with the crisis. In your experience, is COBRA the sort of body which is properly designed for a long-term whole government crisis, or can it only really operate in the first few days and perhaps weeks of an acute crisis?
Yeah, COBRA is at its best, and some of you will be very familiar with this, dealing with, for example, a terrorist crisis. When it's something short, immediate, you need action, you need the people around the table, you need the Met Police, you need all the rest of them there, and you get as much information as you can, and it's something that's dealt with in a few days. It can deal with slightly longer term ones, foot and mouth and all the rest of it, but if it's an ongoing thing that you think is going to be there for a year or more, I would say you don't want to use COBRA. You want to set up structures which are different. COBRA is, partly it's a signalling mechanism to say to the world you're taking this very seriously. But as a kind of structure to sort out longer-term decision-making in something as complicated as the COVID crisis, yeah, I would try to move away from COBRA quite quickly. And
is that in essence because, as an ad hoc committee which convenes to deal with an emergency, it's simply not designed to be able to develop a coherent and long-term strategy, and a strategy and a coherent plan is essential for any government to be able to properly respond to a crisis?
Yes, I mean, and that's what you need to start off with. The government had an action plan eventually, but it's basically, yes, you need, for something like COBRA, for something like COVID, there might be something you need COBRA to meet early on, to kind of, when it thinks, is this a short-term crisis or not? Once it gets to the stage where you've got the information which tells you, actually, this is something that's big and is going to be around for a long time, you then need to say, okay, what are the right institutional structures to handle this kind of crisis? And then you start setting up the machinery of government which will work effectively for this.
And as you know, there were a number of ministerial implementation groups convened. They were then replaced in May of 2020 by the COVID-S, the COVID Strategy Ministerial Committee, and the COVID-O Operational Ministerial Committee. But did COBRA in your opinion, continue to be convened for too long? It was convened until May, in fact. And if so, what is likely to have been the impact of that in terms of the government's ability to respond?
That is incredibly hard for me to say from outside because I wasn't sure why they were using COBRA, to be honest. If the structures were working, you would like to think that they would have meant that COBRA didn't need to meet. It could be that they've given some specific role to COBRA that I don't know about. So,
well, at page 777 of your own article, Far From Well, you did attempt to address that thorny issue. And you were able, in fact, to answer that question because you said COBRA continued to be convened well into May, by which time various implicit political tensions had become apparent.
yeah.
So you obviously did take the view at that stage that it had been convened for too long. What did you mean by...
I don't think... I can't see how you infer that from that sentence.
COBRA continued to be convened well into May, by which time various implicit political tensions have become apparent. So
yes.
It plainly went on to such a point, or until such a time, that these political tensions built up and became apparent.
But you're implying causation there. It's because COVID was meeting the implicit political tensions arose.
But what did
I
you
was
mean
saying that COVID, the implicit political tensions were rising, which meant that certain different structures might be required. So COVID was carrying on, not quite sure why, but it was quite apparent from other events that were going on that there were some internal issues politically which were creating problems. They may, and those were problems probably related to the sorts of things that Patrick Vallance was saying about the different factions, which made decision-making harder. It's not necessarily related to what I call the comitology, the committee structure.
You do, though, express the view plainly that COVID-S and COVID-O, to which I've referred, may not have been brought into existence soon enough.
Well, my personal view has always been that this kind of crisis should have been dealt with by something like what I would call a National Security Council structure, which would have been the key political decision makers plus the key officials round a table. And that would have set the strategy and would have made the big decisions, having got all of the other structures that you would set up to feed those in. One of the great strengths of that NSC structure, National Security Council structure, was that it allowed all the officials to give their best view of the evidence and explain the pros and cons of various different policy options, and then to observe the ministers talk about those different options and come to a political decision about what they were going to do. That system has the great advantage of ensuring that all the ministers get the evidence directly, and with the various experts in the room, they can cross-question each other, and they can cross-question those experts as they wish, but also that those experts go away and can report back to their various groups on why those decisions were made, what the political reasoning behind saying, look, we advised X, but they decided to do Y. And the reason they did that, because they were in the room when it was made, is the following. And people can understand that and therefore interpret that it wasn't that they disagreed with your evidence, for example, they just put a different judgment on the benefits of A versus the benefits of B.
And SAGE, to which we'll turn now, was not a body that enabled that process which you've described to take place. The politicians were not on SAGE, and SAGE provided scientific advice, which was relayed through the Chief Medical Officer and the Government Chief Scientific Advisor.
Precisely. I mean, that's SAGE would have been one of my sub-bodies, although I would have liked a more multidisciplinary sub-body.
We'll come back to that in a moment. So, SAGE, you've referred, Lord O'Donnell, already to the vital importance of the supply of proper advice. And it's self-evident that in a crisis, the executive decision makers, the ministers, must have up-to-date, reliable data and advice. They need that assistance. What about the issue of public trust? in terms of managing a crisis and responding to a crisis, how important is it for the public to know that the government is the recipient of high quality, speedy, proper, effective advice and data?
That is massively important. We know that this crisis would involve asking people to radically change their behavior. And that meant that they had to trust that you were doing this for good reason. So public trust is absolutely essential on this. We have lots of research evidence that in places where trust is higher, lots of things work better. It's kind of fundamental, getting trust up there, and everyone should do their best to think about trust-building exercises, how you ensure that you get across to people that what you're doing is trusted, and often that's through thinking about who are the best messengers for this. Again, it's part of the whole behavioral playbook that people will believe certain people and trust them much more than they, dare I say it, will trust politicians in general. Trust in our politicians is rather low, unfortunately.
And was that in part why, of course, the government proclaimed that it was following the science?
Well, it's a very...
And we'll come back to the detail of that, but there's a link there, isn't there?
There is a link there. What you're trying to do is get people out there as spokesmen, which they did with the Chief Medical Officer and Chief Scientific Advisor, that people will trust that they believe are on top of the science, although I would always argue we need to interpret science very broadly in that term to include social science.
Well, let's look at SAGE briefly, and I just want to put to you a number of propositions drawn, in fact, from your articles about the operation of SAGE. Firstly, in terms of its composition, it's well known that it comprised largely epidemiologists, modelers, behavioural scientists. Is it your view that it was, certainly at first, dominated by medical professionals, and that there were insufficient numbers of experts on infection control, community mobilization, the social sciences, and nursing and intensive care?
Yes, I would say, and I would refer to the evidence given by members of SAGE who've said that there were all sorts of areas that they didn't cover and they didn't understand what research was going on in those areas. So, yes, but obviously there could have been other bodies in which did that.
Well, we'll come to that in a moment. Secondly, do you report in one of your articles that there was an element to SAGE which perhaps indicated that because it was designed to address questions put to it on a commission basis, if you like, it simply didn't feel able to raise issues of its own volition, of its own motion. It was, in effect, too much of a responsive committee rather than a body or a forum which could proactively make suggestions for ministers to decide to accept or not.
Yes, I would agree with that. I think the fundamental problem there, though, was that if you ask SAGE kind of very specific, detailed questions, and it doesn't know what the ultimate outcomes the government's trying to achieve are, I think that's the problem. If you give them something about the ultimate outcomes, then they can talk about various ways of achieving those outcomes. If you ask them a very specific question about what should we do about social distancing, then you'll get an answer about social distancing. You won't get an answer that says, yes, but maybe social distancing isn't the right way to think about this because of the objectives you've given us. And I think that failure to kind of specify what the overall objectives were is one of the things I would kind of look back on and say, that's what made it very hard for all the advisors, not knowing what the ultimate source of this, because there were various statements made like stopping the NHS falling over or whatever, but nobody really, to my mind, ever laid out a good strategy and what the overall objectives. For example, minimizing the impact of COVID on the country as a whole. And then you go from that to say, well, what does that mean? And you could lay it into economic, social, etc., and health, obviously.
A number of the scientists on SAGE in their witness statements have referred to the fact that a lack of a clear strategic direction from the government or a lack of information about the government's priorities made it very much harder for SAGE to understand what it was they were truly being asked. There is, in one particular set of minutes, these words: modelling suggests earlier and or combined interventions will have more significant impact. That sort of phrase may be reflective of this scientific commissioned position, as opposed to SAGE being asked, what do you recommend we should do in plain terms? And is that one of the areas that you think is problematic?
Well, I think SAGE was, as I say, filled with certain set of experts. It depends on the question you're giving them. If the question is, should we close schools, then clearly the kind of experts you need are people that understand the impact of closing schools on the educational effect on children, the effect on their parents, general effect on the economy of doing these sorts of things, as well as the things that SAGE might have been very good at telling, which is the impact that might have on transmission. And so you need to balance all of those things together. That's a hard thing to do, and that's where you really need to be thinking about how can we put this to ministers in a way that it makes it possible for them to bring their judgment to bear, to weigh up these different things, to come up with an answer.
You make the point in one of your articles that, quite rightly, if I may say so, that SAGE was only a scientific advisory group. It simply wasn't constituted to be able to weigh up the economic and societal consequences of any whole society order or measure that might be put in place. And you refer in that context to the vital question of whether or not there should in future be a committee structure above SAGE that can synthesize not just the scientific advice from SAGE, but all the other economic and societal, pandemic management, complex public health issues that might arise outside the narrow confines of a scientific advisory body. Did you have in mind, and do you have in mind, the sort of structure that operates a little like the National Security Council that you've described, where all that material can be put together and officials and advisors, scientists and ministers can cross-examine each other about the import of the information being provided?
Most certainly. I mean, SAGE, the answer's in the name. That's what they were doing, Scientific Advisory Group. It will be crisis-specific, let's be absolutely clear. The people you want around the table, the kind of committee structure you need, will depend upon the nature of the crisis. So I wouldn't have a single answer now. I would say, let's have some principles. The principles should be, let's work out what our objective is. If our objective, for example, with COVID, would be minimising the impact on the UK population, so there'd be some health impacts, there'd be some economic impacts, there'd be some social impacts, there'd be some impact on the well-being of NHS staff. You could go on, and there'll be obviously impacts on and deaths and the like that. So that tells you the kind of structures, the number of experts you need, and the kind of structure you should have. Sorry, too fast. But that, I think, is the way I would set it up. So for each crisis, I would want to sort out the structure, but based on there being very clear strategic objectives of what we are trying to achieve, and then that feeds down to what committee structure you need, what experts you need around that table.
And does it follow, Lord O'Donnell, that if you have, or if you were to have, and if my leader were to recommend an overarching structure above SAGE to synthesize the information and present it in the presence of ministers,
yes,
there would be no need for the relatively narrow conduit that existed during the COVID crisis of SAGE's information and advice being routed through the Chief Medical Officer and the Chief Scientific Advisor to government.
Yes, because when you think about it, SAGE wasn't looking at, say, for example, the economic stuff. So they're always doing a partial thing, and ministers are then going to have to feed that together with other things. So they need to have this information from the range of specialists and advisors that are relevant to the decision they're going to have to make. And that's, again, I stress, these are very difficult decisions because they're having to weigh up, make trade-offs Yes, we could close down, we could lock down forever, but that might have all sorts of negative implications beyond the health ones. So they have to weigh up and make trade-offs, which ultimately are things that ministers are paid for.
And lastly, on this subject and the position of SAGE, do you consider that it was fair on SAGE for the government to declare publicly that its momentous decisions were the result directly of SAGE advice by virtue of the proclamation that it was repeatedly following the science?
If the implication of that is don't blame us, blame SAGE because they advise us, then obviously that is completely wrong. Ministers make decisions. Ministers ultimately can ask for different sets of advice from different sets of people. So when they say they're following the science, I think that's a way of trying to build trust in things. The question is, science is much bigger than just SAGE. There are lots of other social sciences that were really highly relevant to this.
And the government decisions were far greater than science.
Oh, absolutely. Because in science, if we define science very narrowly as the kind of things that SAGE looked at, which were mostly the epidemiological material. Mostly. They did some other things.
Milady, is that a convenient moment?
Yes, certainly. 11:15.
Lord O'Donnell, just some concluding questions, if I may, in relation to the structures and the process issues that we've been looking at. Firstly, the National Security Council system and the National Security Council itself exists in order to be able to respond to threats, and in particular threats which eventuate, which take place, as opposed to risks. So a pandemic is a risk, a terrorist outrage is a threat, and in fact, a threat coming to pass. When you were Cabinet Secretary, did you give consideration to the possibility of setting up the sort of structure that you've described today in relation to risks as opposed to threats?
So something like that did happen when Gordon Brown set up something he called the National Economic Council, which is a bit like an NSC, but also included one thing which I think is really useful in these sorts of committees, which was bringing in outside experts to talk, to focus on some things. So So the idea was that things like NSC would think about threats, as it were, and then when something became very apparent, you would move to some other different structure, which was determined by what the nature of the crisis was.
But in general terms, the position remained that there was a scientific advisory group, there was a COBRA to deal with the acute crisis, and then the lead government department model kicked in.
That's right.
Remained
yes.
as such. All right. Secondly, you are aware, of course, that the government changed from a model in which there were ministerial implementation groups to a system of a COVID-S strategy and a COVID-O operational ministerial group, or two groups. And then ultimately, in late May, or the summer of 2020, the inauguration of the COVID task force. To what extent was that COVID task force not replicative of the process that you've described? Is it because, or if you agree that it wasn't the process that you've described by way of your National Security Council type committee, was it that the CTF was not a ministerial body? Ministerial power remained vested in COVID-S and COVID-O, and therefore what you envisage is in fact an amalgamation of the structures that the government ultimately put in place, namely the COVID task force on the operational front and the COVID-S, COVID-O ministerial committees.
Yes, a lot of people think that you can have one group that does strategy, another one that then goes away and does the operational implications of it. I always think it's important to make sure that you've got round the table someone that actually understands about operations when you're having that strategic discussion, because it's quite possible that that strategic discussion will come up with something which operationally is impossible. And so I was always keen on having the two groups around the table together so that they could actually, the operational people could put their hand up and say, can't do that. And I think there were some operational things here where you look at test and trace, the local authorities were good at it. We dismantled it for some reason. You think about the labs, why did we not use private labs more? There are lots of things where someone with an operational understanding would have said, actually, if that's your objective, you need different answers, and here's what you should be doing.
I've mentioned the lead government department model. Are you aware of the government's December 22 resilience framework document? Milady, that was the subject of great debate, you'll recall, in Module 1. Does that resilience framework document note and acknowledge that where risks are more complex, meaning that there is in essence a whole government response required, there are distinct limitations on the efficiency or efficacy of the lead government department model?
Yes, absolutely. I would say you don't really want a lead government department when it's something that crosses so many departments and has such a big impact on all of them. COVID being a classic, the Treasury, a massive impact, something like the furlough scheme, billions and billions of pounds. So you actually want Cabinet Office then to hold the ring and create structures and bring all the departments together. I think if there's something which is 90% one department, the lead government department thing will work well. When it's much more diffuse and spread, I would go for a much more Cabinet Office-led model.
Presuming that the Cabinet Office is able to step up to the mark in that scenario.
Absolutely.
Yes. And finally, under the National Security Council process, is that a body at which the devolved administrations are represented? Do you recall?
They're not, because of the nature of national security. It's at the UK level. That's not to say you couldn't have a body which did involve devolved. And in fact, I would always say with this structure, you need to modify it for the nature of the crisis. So it could well be the devolved, it could be local mayors, it could be all sorts of things that you would want to add in.
And if, of course, it's a pan-UK crisis, then the devolved administrations would be required to have a seat at the table as co-equals, because, of course, it's a pan-UK crisis.
It's a bit more complicated than that, I'm afraid, because there are various things.
Lord O'Donnell, I knew you would say that.
There are various things that are protected at the UK level that aren't devolved.
Oh, yes. You're talking in terms of potentially national security issues. But for example, in the case of a pandemic, a viral pandemic striking the whole country, under a new model of the type perhaps that you've described, it would be essential to have the devolved administrations represented at that new model.
Yes, I would think it would make an enormous amount of sense to do that.
Strategy.
So before you move on, how do you make sure that that council, that body, doesn't then have so many people on it that it becomes unwieldy and really doesn't do anything?
Absolutely right, which is why we talked about devolveds, very small number of devolveds. Once you start thinking to devolve below the nation state, and so you're talking about regions and local mayors and all the rest of it, you're absolutely right. So I think there is a case for there being that overarching body, and then thinking about one of the subgroups having much more representatives of local authorities, devolved areas, mayors, depending on the different structures we have around the country, which are very different. But to lose that information, I think would be a real mistake. But you're absolutely right. That these bodies work because they're relatively small, and you shouldn't. Cabinet is a very big body, and therefore that creates limitations to what you can put to cabinet. The NSC was deliberately kept quite small.
Sorry to interrupt.
Milady, not at all. Strategy. I really don't want to ask you to get into the weeds of the debate about the relative merits of suppression, that's to say control of a virus, as opposed to mitigation, that is to say flattening the curve or squashing the sombrero. In one of your articles, however, you make the point that it is an essential part of strong political leadership in the face of a crisis to have and to communicate a strategic plan. Why, Lord O'Donnell, is that so? Why is it necessary for a government to have a strategic plan in a crisis and to communicate it?
It's
shortly, if I may.
Sure. It is absolutely vital because the decisions you're making will involve trade-offs. So let's imagine the objectives are to minimize the number of deaths, to minimize the impact on the economy, to minimize the effect on children and their education, etc., minimize the impact on the well-being of the UK population as a whole. How do you do that? How do you do those trade-offs? So if you have a strategy which has the overarching goals, then you start to say, okay, so tell us more about how you see the trade-offs. One of the issues that you would like to have is a consistent way of making trade-offs. People might disagree with the weights you give the different parts of the trade-off, but actually for them to be consistent is absolutely vital. That leads us into the whole of my push for there being a well-being approach to all of this and using well-bees and various technical things which haven't been used yet, but which I'm glad to say the Treasury's own green book now has supplementary guidance on how you might do this kind of analysis.
We'll return to the question of your well-being structure or framework in a moment, but is this the nub of it? In order to be able to take the country with it, the government ought to and must, in fact, demonstrate what its plan is in order to increase confidence, to greater ensure compliance. But also, if it has a plan, is it more likely to be able to discharge the primary function upon it of making the right decisions?
Absolutely. If you've got a plan and you've got clear objectives, then you can work to that. It makes the communication, and I say this as a former press secretary to a prime minister, it makes the communication easier. If the communication is easier, you build up trust. And in as we said earlier, when you're asking people to change their behavior radically, far more than I ever thought any government ever would, you need that trust, that this is based on some really good evidence and is going to result in better outcomes.
As far as you were able to say, did the government ever publicly debate, put to the country, this what its strategy was in relation to what level of loss of life it would deem acceptable? So in this debate about suppression, that's to say complete control or mitigation, there is this terrible issue of herd immunity. If you are merely mitigating or managing a virus, it by implication, it requires the virus to spread through or to continue to spread through parts of the population that you're unable to hermetically seal. Did the government, in your view, make plain the limits of and the nature of this strategic debate, the strategic issue?
I think they were very nervous to do this, and I think they were very nervous because if you take the implication of your statement to its logical conclusion, it gets you into a discussion of what's the value of life. And we know that governments routinely make decisions based on a particular valuation. The cost-benefit analysis for roads, dating back 30 years, has done this.
And medicine,
NICE, for example, when NICE works out whether, National Institute for Clinical Excellence works out whether a new drug can be made available. You're doing these things. Politicians very rarely like to have that debate because it's a very cold-hearted debate to say, actually, it's not worth saving this life because it costs too much money. So it is difficult for them, I accept that, but actually implicitly they are making those decisions. So it will be good if even implicitly they were understanding that behind this there is a consistent application of their judgment as to what the trade-offs are.
Another aspect of government decision-making and the ability of the public to understand what was going on and what was being decided and on what criteria these momentous decisions were being made. The material demonstrates very clearly that at the very highest level, the prime ministerial level, there was a certain degree of what has been described as flip-flopping or trolleying behaviour. That is to say, a apparent inability to be able to make a decision and stick to it. It may be self-evident, Lord O'Donnell, but why does a consistency of approach matter so very much in the teeth of a crisis?
And I think that's important because when people talk about flip-flopping, there could be good reasons to flip-flop and bad reasons. And if you have a framework which basically says, look, you know, here's the way in which we're making decisions about whether to lock down or not, you know, the costs and benefits of lockdown and how we're trading them off. And they're based on this data and information. If that data and information changes, then it makes perfect sense to change the policy and to change your decision. And you can do that and maintain trust if you've established the framework and people understand the framework and they understand why you've changed your mind. And I think this is the key point, that it's not necessarily wrong to change the policy prescription at a certain point in time if new information becomes available, which you didn't have at the time, which says actually that policy B turns out to be better than policy A, which you chose in the first place.
How are you ever going to get that realistically? How are you ever going to get a political party to talk to the public about possibly allowing a disease to run riot through care homes, killing people in large numbers? I mean, yes, you could have a rational debate of the kind you've talked about, but is that really going to be something a political party is going to want to engage in with the public and possibly hostile sections of the media?
That's a very good question. I mean, there's nothing to stop the public inferring what the implied value of life is. And indeed, you know, some people did that. So it's not like this is hiding away. I think part of political leadership is getting the public to face up to the fact that there are going to be difficult decisions, that we can't save everybody. Therefore, we want to put our resources in the places that will save the most people that we can. Now, the public would get that, and they would understand that you know, there were limitations on what could be done. But the fact, if there is trust, that you are really trying to do the best, and having laid out in your strategic plan what the best means, then I think you start to build public trust, and you can start to have that debate.
And these are fairly obvious issues, albeit of the greatest importance, the most momentous decisions for any society. But they're at the level, aren't they, of asking the country, do we do whatever is necessary to avoid death at all costs? To what degree do we batten down the hatches in order to prevent the spread of the virus at any cost? To what extent do we seek to try to hermetically seal segments of the population and thereby allow the virus to continue to spread amongst those who are more capable and more able of being able to deal with it? Is that the sort of level at which this debate is required?
What's essential is to get across to people that there are always trade-offs. You know, the fact that there's a new drug becomes available and it's £10 million and it will extend someone's life by 3 months, whereas you could use that £10 million in another way that would extend babies' lives forever, for the rest of their life. Alas, these are the tough decisions we have to make, and leadership is about confronting people with those tough decisions. And
if there is a framework
exactly.
by which the cost and the benefit of these decisions can be objectively evaluated, then that will promote consistency of approach and better enable decision makers to be able to make a rationalised and perhaps more straightforward decision.
That's what all of my articles were about. It's like the need for a framework. And one can argue about what goes into that. One can argue about the parameters as to, what value would you put on life or whatever. But if you've got a consistent framework, at least you then start to have a grown-up public debate.
Could we have on the screen, please, 000189725? This is, Lord O'Donnell, your article, When to Release the Lockdown, a Wellbeing Framework for Analysing Costs and Benefits, from, I think, April 2020.
Yeah.
But in any event, on page 4, paragraph 2 of this article, you set out the metric, that is to say, a chart setting out the sort of considerations or issues by way of the cost and the benefit of any particular decision, so that you can see how it might operate in practice. So you refer there at paragraph 2 to the analogy with the QALY metric, which is the metric which is used in the NHS for being able to evaluate the cost and the benefit of particular treatment, also triage, and a number of matters relating to clinical affairs. And what you've proposed is that in the different field of whole society, whole country measures by way of social restrictions, for example, it should be possible to identify the costs and the benefits of such measures by reference to matters such as the impact on income, the impact on unemployment, on mental health, confidence in government, educational prospects, and the benefits in terms of fewer deaths, of course, because it's largely a mandatory system for compliance with social restrictions. Fewer deaths in terms of road deaths, commuting, the impact on CO2 emissions, and so on. And that is the chart which you produce on that page. We can see there on the screen. You've made the point that, of course, the parameters are open for debate. But is it your view that this sort of momentous decision, a whole society decision, which is not a decision to produce a medicinal product or to give treatment to an individual, is capable in principle of this sort of cost-benefit analysis?
I think it is. I think with all of those numbers, those parameters, there will be disputes about what the right number is. We put these numbers in mainly not to say precisely when lockdowns should change, but to show that there was a framework that could be used. Government would then say, actually, we don't really care much about the income effects, but we care massively about the mental health effects or whatever, and give their own weights to this. And then the great virtue would be they'd apply some weights, and then when it came to a future decision, you could say, okay, so we assume the weights are the same. So that would rationally help you explain why you'd move from one position to another. But I do think it's a very important way of being able to present to ministers the trade-offs, the really difficult decisions they have to make. Without this kind of thing, you end up, and I've seen them, endless submissions which list, there's going to be effects on these 5 things, and there's going to be good effects on these 5 and bad effects on these 5. Well, how do you weigh them up? And that's what QALY's tried to do, quality adjusted life years. That's what wellbeing is. There are ways of bringing these things together.
All right, thank you. Final topic is that of trust in government. It is obvious and it is well understood and known that there were a number of breaches of rules and standards by ministers, officials and advisors, in particular in Downing Street. The social and personal impact of those breaches is obvious. It was outrageous that whilst members of the population buried their loved ones, that sort of behaviour was going on. But systemically, in terms of a government's ability to ensure compliance and to ensure that it takes a country with it in terms of these whole society measures, why does leadership and setting an example and the behaviour of government officials and ministers matter so much?
It comes back to the point you have mentioned many times. It's all about trust. And it's all about building that trust that actually you're putting forward, unprecedented restrictions on people's behaviour because you think they are in those individuals' best interests. And if you then operate in a way that says, actually, but you're not going to, you don't think they're in your own interests, so therefore you don't follow them, that destroys that trust. So it is absolutely essential that you demonstrate by your behaviours that you believe what you're saying to the public is the right thing to do and your own behaviours follow that.
And so putting aside the personal opprobrium, any view on the behaviour of those who were involved, in terms of a government's ability to be able to manage a pandemic, was this incredibly destructive?
Without a doubt, it was destructive because, you're relying on a behavioural response, right? You're relying on people complying with rules. And for most people, that will be about whether they decide that that's what they should do. It's not about police enforcement because there aren't going to be police chasing around everywhere. So it's do they think this is the right thing? Do they trust the people that are telling them this is the right thing? When that trust breaks down, then people are going to say, well, should I do this? I mean, and that's the whole point about these behavioural compliance changes, is that you need people to respond to them. And, you can imagine there having been lots of lapses this time. If you were trying to do this again, would you get the same levels of compliance? And really, once you've made the decision, let's assume the decision is right, that various things are required, you really want people to comply with it. And therefore, you need maximum trust. So, yeah, I think it has been damaging and damaging to future ability of governments to get across behavioural issues.
The police issued, I believe, 126 fixed penalty notices to 83 individuals in and around Downing Street. It may be thought that there was a general ethos of misbehaviour. Had you known, would you have allowed parties to take place in Downing Street?
Absolutely not. I mean, this is under no circumstance would one want a party which violated the rules that you were telling everybody else on terms of social distancing and all the rest of it. No question about that.
Thank you.
A couple of questions, Lord O'Donnell. Firstly, if you had the kind of structures that you would like to see in place ready to respond to this kind of emergency with kind of membership and sub-bodies you've described, to what extent would the perfect structure, in your view, be undermined by personalities?
Well, that's why you try and create structures that are, as it were, independent of personalities. That's why, in a sense, when faced with the question about why is it that chancellors decide to cut interest rates ahead of elections when it's not in the best interest of the economy, you say, well, let's set up a structure where they can't do that. So you've given the power to the Bank of England. There could be some institutional changes which take power away to bodies that we professionally trust. So that's one possibility. But there is also this aspect that our system does depend upon people behaving well. I mean, Peter Hennessy called it the good chaps theory, which is a bit sexist, I have to say. But I do think that there are some areas where this showed up, that our system operates if people abide by the rules. When they start not abiding by the rules, you get serious problems. And we need to look again at our structures to say, do we need to tweak them in some way to make sure that these things operate. I would say, in my time, we put together the Cabinet Manual, which was kind of pretty much trying to bring together the rules. I hope a new version of it could strengthen some of those rules, which learn from the problems we've had this time around.
Last question from me. In my lifetime, I've seen the growth of and use of, importance of SPADs. What is it like for a senior civil servant operating with SPADs? How does that relationship work?
So I'd say, I've always said this, good SPADs are worth their weight in gold. I work with people like Ed Balls and Ed Miliband, who were special advisors to Gordon Brown. They were really helpful to the civil service. They trusted and respected the civil service, and they were good avenues and sounding boards for finding out what the Chancellor, whose time is very limited, would think about something and how you might manage, trying to help them make the right decisions and the kind of information they'd need. And I've also seen bad special advisors, and they are disastrous. And they're mostly disastrous for the minister that employed them. They end up bringing the minister down quite often. So I would say that there is a lot to be said for restricting the number and making sure that they have good training. Good SPADs are technically well trained. Ed Balls knew a lot about the economy, economic issues. That was really important. If you've got a bunch of SPADs who are trained in PR work and who only think about particularly pushing their individual minister and their status and how their minister got it right and everybody else got it wrong, they're the pretty disastrous ones. They add very, very little, and quite often they're working for a minister rather than the government, and therefore they're damaging to prime ministers and cabinet government in general.
So having said it's my last question, just following on from that, and when you have, so the SPADs are basically political advisors, and when you have a political party who obviously want to make sure that they get re-elected, how does the civil servant maintain their independence and objectivity and not get swept along with this will play well with the electorate or that won't play well?
Well, you need to, so civil servants need to be political with a small p. You need to understand that when you emphasise one policy rather than another, it will have political implications. And the SPADs, it's their job to come in and point out those political implications. It's your job as a civil servant to say, actually, we think policy A is best for the country as a whole. Yeah, there might be some political problems, and you might want to talk to your SPADs about how you mitigate those political problems. But our job as civil servants is to say what's best for the country. And we will say, in the long run, Prime Minister, I always do this, that's what's best for you and best for your re-election chances. Could I just say one other thing?
Yep.
Lord O'Donnell, are you about to raise the issue of the global comparative study?
Okay.
So, my lady, there are no questions from the core participants, or at least none in relation to areas that we together haven't covered. But this morning, Lord O'Donnell mentioned a great interest that he has in the need for there to be, in light of this pandemic, a far more sophisticated global comparative study of the impact that the various government NPI decisions have had. Is that the nub of it, Lord O'Donnell, that there is a need for us all to be a great deal better informed about how comparatively the various government decisions which governments around the world have made in the face of this pandemic in fact operated, and to what level they had benefit?
That's exactly right. The reason I make this point is that there will be lots of individual inquiries that will look at the impact for their country. If you want to try and find out, for example, did lockdown work? Did these other things? You need to start with, so what's your ultimate objective? Let's say it was excess deaths or whatever. But there's going to be lots of countries around the world that did different things with the same virus and had different outcomes. By looking at that large sample of lots of different countries, we can infer, controlling for all the other factors like age distribution, ethnicity, there's lots of other things going on, but a really good study could look at all of those things and would I think, be a massive advantage to the world. And it's really hard for any individual country to do that. So I just hope that somewhere along the way you can give a push to someone doing that.
Thank you.
My lady, that concludes the evidence of Lord O'Donnell.
Thank you very much indeed, Lord O'Donnell. Extremely interesting. Thank you.
Thank you, Maureen.
My lady, the next witness is Professor Sir Ian Diamond, the National Statistician and Head of the Office for National Statistics. Yes, please.
Would you like to take that in your right hand and then repeat after me? I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Good morning. Could you give the inquiry, please, your full name?
I am Ian Diamond, and I am the National Statistician.
I'm going to call you Professor Diamond, if I may. You are, in fact, Professor Sir Ian Diamond, but for ease of reference, that's how I will address you, if I may. Professor, you have been good enough to provide two very extensive witness statements concerning the extremely important issue of statistics, the relevancy to this inquiry into the pandemic, which is obvious. You provided one dated the 8th of September 2023, 268012. I think that's the one on the screen. You would have signed that, I think, on the 8th of September with the usual declaration of the truth of its contents. And you also provided a second statement in which you produced a very large number of tables and charts relating to specific areas of data and statistics compiled by the ONS, the Office of National Statistics, to which we'll come in a moment. And is that one dated the 11th of September, 271436?
Yes.
Whilst you give evidence, Professor, could you please remember to keep your voice up and also speak as slowly as you are capable of in order to assist our stenographer. I'm going to start, if I may, with that first statement, the statement of the 8th of September, Professor, because it sets out, does it not, the building blocks for the data, the specific data and statistics which you then provide, setting out how the UK Statistics Authority and the Office of for National Statistics operated during the pandemic. Dealing firstly with the nature of the ONS and of the UK Statistics Authority, you are the National Statistician.
Yes.
What is the National Statistician?
Well, the National Statistician was a post first brought into place by Winston Churchill when he was Prime Minister, when data from different parts of government were coming to him, and he decided that he needed someone to adjudicate on which ones he should use. And that is a role that I take very, very seriously. But at the same time, I am the Chief Executive of the UK Statistics Authority. The UK Statistics Authority is an independent body which is charged with all matters related to statistics, both regulation and production of official statistics. And I head the Office for National Statistics, which is, if you like, the statistics production arm of the UK Statistics Authority. In addition, I am head of the Government Statistical Service, which covers statisticians right across government. I provide professional leadership to them, although they are employed within their department or arm's length body. And I am head of the analysis function, which brings together statisticians, economists, operational researchers, actuaries, geographers, social researchers, and operational researchers right across government.
That is quite a number of statistical hats to have to wear, Professor.
It is.
The position, therefore, is that the UK Statistics Authority is actually the independent statutory body established by law, and you are, as the national statistician, as you said, the chief executive of the board of that body. It has a function, or part of it is the Office for National Statistics, which produces the statistics and the data, and that authority provides oversight of the overall provision of statistics by the government, which might be usefully described, as you said, as the Government Statistical Service.
Yes.
But for our purposes, therefore, what we are most concerned about then is the production of statistics by that production function arm, namely the Office for National Statistics.
Yes.
It does the heavy lifting of the production of statistics.
Very much so.
All right. You are supported by 3 deputy national statisticians. Is that
Yes,
right?
the 3 deputy national statisticians, each of whom take a different area, one economic statistics, one population and health statistics, and one broadly data governance and IT. I'd have to say that over the course of the pandemic, sometimes as different areas became more important, we flexed some of those responsibilities, but 3 deputy national statisticians. And I was also supported from...
Just slow down a little bit, please,
sorry.
Professor.
I will slow down a little bit. And I was also supported from September 2020 by Second Permanent Secretary Sam Beckett.
It is obvious that during the pandemic, the Office for National Statistics discharged the extremely important functions of informing decision makers, the government, with regular data and analytical insights, and also informing the public with the state of play and what the statistics and the insights produced by the ONS were amounting to. We're going to look at the specific supply of data in a moment and the particular analyses that you produced. But in general terms, did the ONS start producing data for government at a relatively early stage of the crisis? Or in your opinion, could it have provided that vital support at an earlier stage, and no doubt would have done so had it been asked?
Yes, I mean, I think we became seriously part of the production of new insights in March 2020. I think my personal view would be that we should be involved at the earliest possible stage. But of course, you need to know what questions there are to be asked. And so we were involved from an early stage, but perhaps not the earliest stage.
From the stage at which you became involved, did you produce the whole plethora of charts and analyses and data sets, or did the system ramp up to the point at which you were providing a great deal many data sets and analyses?
I think I would have to say that we were agile in responding at different times to different questions, but there were really 3 main areas I would point to. Firstly, we needed to maintain our business as usual measurement of the economy, for example, monthly inflation rates. Now that's hard if you're not able to go into shops to check on prices. It's hard if companies are furloughed to know how you estimate their output. So there were some changes that we had to make very quickly to maintain that economic measurement. Secondly, we moved very quickly to providing insight. Very early on in the pandemic, I did feel that while data were flying very quickly, actually, as I said to one person, I remember saying, this is a data deluge. We need to bring data insight. And I pushed very hard, and ONS pushed very hard, to make sure that instead of, for example, saying, tell me something interesting about, we moved to what is the question you want an answer to. And we, ONS, embedded someone inside the COVID task force in the Cabinet Office to be able to get those kind of questions. And that led us to really answering new questions. So, for example, setting up a COVID infection survey to understand the level of positivity and indeed antibodies in the country, and also to understand more about opinions and attitudes.
And do you therefore, or have you therefore referred to an important distinction in this field, which is the distinction between the provision of data sets, hard statistics, and insights by way of analysis drawn from the various surveys which the ONS carried out?
Well, sometimes you would do analysis on those former data sets. So yes, one provides data and enables others to use it, but at the same time, one does analysis which enables questions to be answered.
And was the ONS therefore able to produce data and insights across a very wide number of societal themes? So, for example, economic data, social data, plainly data in relation to health, and mortality, and also across great swathes of British public life, so across business, across schools, and so on.
Very much so, and some of those data, you mentioned economic measurement, were things we would do anyway, but we had to pivot in the situation where, for example, we couldn't send interviewers into homes to make different ways to collect those data. But also, we produced new data and we did new surveys. We tended to do new surveys in partnership with real experts in those areas. An example would be when there was a need to understand what was going on in care homes, we partnered with Professor Laura Shawcross from University College London, who was an expert in social care, and to design with her a survey of care homes using the care home chain Vivaldi.
And so did you introduce a number of different surveys, the business impacts of coronavirus survey, the schools infection survey, SIS. You've mentioned the COVID-19 infection survey already, CIS. Did you also introduce or make changes to a particular type of data analysis known as the Opinions and Lifestyle Survey, OPN? What is that, and how does it differ from other surveys or from data sets?
Well, the Opinion and Lifestyle Survey was a survey which went out every 2 months and is what it says, an opinions survey to understand attitudes. Sometimes it's nice to know fixed data on how much a firm is making, but sometimes you need to know attitudes, and the only way I know how to get attitudes is to ask people. And so we have a methodologically rigorous survey which went out every couple of months. We pivoted that very quickly to go out every week, and so it would go out on a Wednesday. We would close responses very early on a Monday morning and have results Monday lunchtime, so that we were able to understand what was going on and the attitudes of the public in a really quick and timely manner. And we worked with parts of government who wanted questions put into that survey to enable them to get the insights very quickly that they needed for their policy making.
Just on that question of OPN, Opinions and Lifestyle Survey, was the Cabinet Office, and in particular the COVID-19 Task Force, and the COVID-19 Task Force was only brought into play in the late summer, were they primary users of that data in particular?
They certainly used it, and indeed, as I indicated, we had embedded someone into the Cabinet Office to be able to understand the key issues of which answers were needed. And so they were primary users, as were other parts of government, including health, and also we were able to get behavioural information. So one of my colleagues joined what is known as SPI-B, the behavioural science part of SAGE, to make sure that some of the behavioural science questions that they wanted asked could be asked.
And did you, in fact, yourself personally attend SAGE?
I personally attended SAGE from the 15th meeting on the 13th of March 2020.
Did the ONS also create something known as the COVID-19 latest insights page?
Yes.
In order to educate the public who had access to that information, and it collated other separate data sets together centrally to make it easier to digest.
We thought it was incredibly important to provide accessible data to the public, and we did this in a number of ways, and the insights was where we tried to bring together data from various sources and put them in one easily accessible place. The other point I would mention is that throughout the pandemic there were daily press conferences, and early in those press conferences perhaps the quality of the slides that were presented were not of the highest level, and so we were asked and embedded a team in the Government Communications Service from pretty early on to help with the production of those slides. And I know I would say this, but I did feel that the quality of those slides improved greatly when the ONS team were there.
You say in your statement that the organisation worked hard to maintain quality whilst delivering to a fast timeline.
That's right.
Is that a euphemism for saying you worked flat out?
It is. I mean, just to give you
Day and night.
Well, just to give you one example, if I may. We are charged with providing weekly death registration by cause of death. Since 1993, the death certificates come to us, and we can computer-wise put them into cause of death reasons. There wasn't a cause of death for COVID. We worked with the World Health Organization quickly to define a cause of death, but there was obviously no time immediately for that to be automatically run. And so my colleagues who do cause of death registration, and I have to say this is a pretty stressful thing to do, went on to 12-hour shifts to enable us to be able to deliver those statistics on a weekly basis, and I really do hold out my hat to them.
Can we just take a step back, please, and look for a moment at the phrase weekly death registration by cause of death? Is the position in the United Kingdom that every death has to be registered, perhaps with the assistance of a coroner or a coroner's officer, and that is a formal document, but it is a document limited in terms of the information that it provides to the age, sex, cause of death, and I think the location of the deceased.
That's right.
And therefore the ONS could access on a weekly basis cause of death registration documents, but that cause of death did not in the early stage include, you've just told us, COVID-19 as being a cause of death.
Well, it could do. The cause of death could be written by the practitioner and was as COVID, but what we didn't have was an automatic process to then turn that into the weekly statistics. So we had to take the cause of death, or the death certificate, read it, take a view, and then manually transform it until we were able to actually move to an automatic process.
We'll look at the system in more detail a little later, but were those weekly cause of death registration documents the genesis for the core death from COVID data sets?
Yes, for death.
Produced by the ONS.
That's absolutely right, yes.
Right.
I should just add a rider, and that they don't include deaths which have to have a coroner's inquest. We don't get, well, we get them, but only after the inquest and that can be some time.
All right. Could we have, please, on the screen 000252620? You've produced for us, have you not, by way of exhibit, a list of all the data sets that you produced during January 2020 to the end.
Should I be able to see something on my screen, sir?
You will in a moment.
Thank you.
We're not quite as fast as the ONS, Professor. So that's 252620.
Whilst that document's coming up, you said that you worked with WHO about a cause of death for COVID sufferers. What was the end result? In other words, what went on the death certificate to indicate that COVID was a cause?
It could either be death virus identified or death virus not identified. And the distinction really is a minor one, but it's very much the one around had the person had a test and had that test proved positive. And we would put the two together because sometimes the medical practitioner is pretty good at identifying what has happened, we would suggest.
Doesn't it depend on the medical practitioner? I mean, I've seen a death certificate that said old age. Or heart failure, which arguably sadly applies to everybody who dies. Was there a problem in getting the medical practitioners to provide the information you needed so that the government could know just how many people were dying with this awful disease?
We believe that pretty quickly the medical practitioners were able to identify whether there had been a test. If there had been a test, then they wrote COVID-19 either as the primary or the secondary data. I have also seen many certificates which say old age or whatever, but we were getting that. But also where there had not been a test, but it was pretty clear to the medical practitioner, and these are smaller numbers, the majority there'd been a test. Where there had not been a test, then it could be virus not identified.
Thank you.
Professor, I'm sorry to say that we're unable to get the document up on the screen that I had wished to put to you. So may I put the point in a different way? The overall list of data sets which you provide are voluminous in number. You provided a very, very large number of data sets to the government during the pandemic. But does the list of data sets show that from a relatively early stage, your data sets and your OPN surveys focused in on the impact of the pandemic on members of ethnic minority groups, as well as on those who were clinically extremely vulnerable? So ethnicity and vulnerability were topics, positions, issues for your data examination to look at, and they were from a relatively early stage.
Very much. One of our pillars at the Office for National Statistics is inclusivity. And we, if you like, lived that value right the way through the pandemic, that we were trying to make sure that every citizen had a voice in our data and that we were, if you like, understanding through our data the inequalities that existed through this dreadful disease.
In your statement, there is a section dealing with quality and accuracy. It is obviously of huge importance that the information, the data that the Office for National Statistics provides is accurate. Is a great deal of work done to ensure the accuracy of the work product?
Well, yeah, at the end of the day, we have to have the highest quality data. There's not much point in us giving people data which are not accurate. Having said that, all data are subject to uncertainty, and we always try to give a measure of that uncertainty with our data. It's often called a confidence interval, but which is incredibly important. When you do a survey, you're making an estimate of what's going on in a population, and that estimate is subject to some uncertainty. But we worked very hard to maintain quality, and I'd say in 4 different ways. Firstly, conceptual. For example, if a company is furloughed, how do you estimate in the gross domestic product their output? Or how do we estimate in education outputs homeschooling? So really conceptual issues there. Secondly, issues around data collection. We couldn't go into people's homes to ask them, so we pivoted very quickly to telephone interviewing, for example, in our crime survey of England and Wales. Thirdly, we introduced what we call weighting to make sure, to come back to your point about inclusivity, we weighted some of our data to make sure that they were really good population estimates, so methodological input. And finally, we had to pivot very quickly our own internal workforce to working from home, and we did that at great pace. Those 4 areas really done at pace, always focusing on quality.
Professor Nasru, who was a witness from whom my lady heard last week, on the issue of ethnicity, referred to ONS data drawn from the 2021 census, which included data that was backward-looking. So it included, in fact, I think, or rather, sorry, the survey or the data set produced by the ONS included information that was backward-looking. It looked back towards data from 2012 to 2019. And he described that particular data set as being based upon experimental statistics. He described it as innovative and exciting, but ultimately open to some degree of debate or uncertainty. What is the degree of accuracy or probity of experimental work done by the ONS?
We would say it was highly accurate, but it's a new methodology. And I think you are referring with Professor Nasru to some work where we linked 2011 census data with mortality data between 2012 and 2014. We are working with Professor Nasru on that at the moment, just to make sure that he is comfortable with what we happened, and I'd be delighted if it would please you to send you a short note, which should be ready in a couple of weeks of that. But you see there, what we're doing there is really innovative because, as you rightly said, death registration does not include ethnicity, for very good reasons, actually. But therefore, what we did was link the death registration to the census data, which would have ethnicity, and of course one's ethnicity doesn't change. And that was innovative work. We're very comfortable that it's accurate, but because it's innovative, we call it initially experimental before we finally move to doing it, if you like, on a very regular basis and when it would become a national statistic.
Thank you. Did you provide, from January 2020 to May 22, what you described as management information from ONS surveys to ministers, key officials, key departments, so information drawn from many, if not all, of the surveys, the CIS survey, the SIS survey, the weekly mortality statistics, and so on, to which I've referred. So you provided, for management purposes, to enable the government to respond more efficiently to the crisis.
Yes, we did. So
certain amounts of data.
So and we would always then publish them. But so, for example, with our COVID infection survey, we were ready so that we would, if you like, stop the last test, or the last test which we would include would be on a Friday. It's quite a lot of analysis. This isn't, I would suggest, a question of just doing a few 5-bar gates on the back of an envelope. There's a lot of mathematics that goes into making the estimates. And we were ready, typically by Tuesday evening, to have some numbers. And things were moving so quickly that we judged it was important to enable people to have those early data, which would then be subject to further quality assurance and preparation for publication, and they were then published on the Friday. But particularly if you go back to some of the Omicron wave, where the doubling time was 2.5 days, we didn't want, if you like, to be providing historical information. We needed to be providing data as quickly as we could. And so enabling government to have those numbers as management information, as they're called, but subsequently to publish them is the right thing I would suggest to do.
And therefore, did information go straight from the ONS to the Cabinet Office, to the Civil Contingency Secretariat in the Cabinet Office, and to the Data and Dashboard team, which was the primary team concerned?
There is a list which I could provide.
Just a yes or no,
yes,
first will suffice. Thank you. You've mentioned the COVID-19 latest insights, which is a live roundup of information. Over time, did that provision of information, that insight, change? Did it, in fact, expand, become developed, and then ultimately merge with other roundups that the ONS produced?
I mean, ultimately, yes. So we wanted just one. But yes, it definitely did change over time as different questions became important. So, for example, our opinion and lifestyle survey at times asked questions about attitudes to face mask wearing. Now, that is the sort of thing that would come in and then we wouldn't ask forever. And so there was certainly an agility in what was there because we were providing answers to questions that were relevant at that particular time.
And did you yourself have regular meetings with permanent secretaries? You attended SAGE, as you described. Did you meet also with the Chief Medical Officer, Professor Sir Chris Whitty, the Chief Scientific Officer, Sir Patrick Vallance? And did the ONS engage with a number of government departments as well as the devolved administrations in order to be able to understand what it was that they wanted?
Yes, and to explain the nuances of any analyses that we gave.
You have described and outlined a number of the different data sets and the surveys, the Opinions and Lifestyle Survey, the Business Insights and Conditions Survey, and the COVID-19 Infection Survey. Focusing for a moment on that latter survey, the COVID-19 Infection Survey, was the need for the sort of data that infection survey produced discussed at a relatively early stage at SAGE by you at a particular meeting in April?
Indeed. You may recall that at that time, test and trace was stretched, GPs were stretched, and the answer to the question, what proportion of the population are positive, was one that was seen to be incredibly important. I'd have to be honest and say, when I'm asked to do this, the statistician in me says, let's do a survey. And so we designed very, very quickly a survey in partnership. We wanted to work, we are statisticians, not virologists and epidemiologists. And so we worked with the University of Oxford, and often these surveys, rightly take quite a long time, but the importance and the urgency was such that we, between a Thursday, when the SAGE meeting was held, we were in the field the following Thursday. And so that was much faster than we would normally do. And at that time, we weren't sure how people would respond to giving swabs, to 20% giving blood. And we designed a longitudinal study, a longitudinal household study, which I remain extremely proud of the design and which has been extremely helpful in a number of other areas, for example, in being able to monitor long COVID.
And was the CIS survey the largest regular survey of coronavirus infections and antibodies that the ONS carried out? Did it start, well, you've described how it commenced. There were pilots, whether or not that took place in England, and then fieldwork began, and that fieldwork expanded to the devolved.
The pilots, just because of the need, the pilots were very, very, if you like, quicker. We expanded very quickly. We then brought on Wales, Northern Ireland and Scotland, and we were asked in the summer, late summer of 2020, if we could move from national estimates to regional estimates. That requires an increase in the sample size, basically. And so we moved to a larger sample size. We were doing 150,000 swabs a fortnight. And that was the largest survey, certainly, of the site that we did. It was also the largest, often, I think, probably the only survey of its type in the world, and that required, and that gave a lot of interest from other countries who wanted to gain some of the insights that we gained.
Another area on which you focused your attention was the prevalence of the long-term symptoms following infection from COVID, known, of course, as long COVID. Your witness statement makes plain that you received a request from, in fact, number 10 Downing Street at one point in September 20 for data on the prevalence of the long COVID condition. When did the ONS start collecting data specifically on long COVID? Can you recall?
Yes, so that request came from the data science unit within Downing Street. And as I indicated, we had put in place a design which is called a longitudinal design, by which I mean we go back to the same people once a month. And so that's quite helpful in this case. And we were collecting some symptoms. So initially, we used the design that we had and followed up people, and in late 2020, we were able to make some initial estimates of those people who had experienced symptoms for 4 weeks or more. But at the same time, we worked with other people who were, if you like, experts. So I know that you are speaking to, from your programme, Professor Cunty, I think, later this week.
Indeed.
We worked very closely with Professor Cunty, and also we worked with some of the long COVID sufferers groups to be able to make sure that we had an appropriate survey. It was the COVID-19 survey, but we added appropriate questions around symptoms that could then enable us to make better estimates because we had better symptoms data.
And so the upshot was, Professor, that having started to commence data, the collection of data on long COVID, eventually you added questions on long COVID to the main COVID infection survey, and then you ultimately produce monthly surveillance estimates on the prevalence of long COVID alongside the other monthly data sets that you provided.
That is correct.
Just a yes or no,
Yes.
if you would humour me in relation to that particular point. Thank you. Can I turn then to mortality statistics in order to set out some of the ground rules relating to that type of data before we look at the actual charts? during the period of the pandemic, were there two main data sources available on deaths? The data provided by the DHSC, generally daily, and the weekly death registration data that the ONS provided, of which you've already spoken.
Yes.
Did the DHSC data on deaths come from other bodies?
No, so the DHSC data, which I think are very useful as, if you like, an indicator, are based on the reported deaths in hospitals. So
the information came from other bodies such as NHS England,
yes,
Public Health
that's
Wales, Health Protection.
To the NHS.
To the NHS.
And the DHSC published them, but of course that doesn't include deaths in private homes, for example, and it is just based on the number of deaths reported on a particular day, so one tended to see a reduction every weekend, just simply because deaths were not reported on those days. I believe those DHSC data were incredibly useful as fast indicators of what was going on, but they did not have the true picture, and that came from our weekly data, which was able to be based on the death certificates, as we have discussed earlier.
And is this the nub of it, that the DHS data originally, in the early days of April, reflected deaths in hospital where patients had tested positive? Later, they started to publish data daily of figures on deaths, all deaths where there'd been a positive test, wherever the death had taken place, so not just in hospital. But although the DHSC data turned itself around quicker and was generally indicative of trends, the ONS measure, which rests upon the registration of death certificates, provides a more accurate assessment of deaths involving COVID.
Yes.
Thank you. And could you please answer this particularly difficult question about the death certificates? Do the death certificates reflect deaths in which COVID-19 has played a part, or deaths resulting from infection from COVID-19?
Both.
Both. Is that in part why those statistics are therefore, or those registrations are more accurate?
Yes.
Deaths in care homes, did the ONS produce data releases relating to deaths in care homes?
Yes.
Deaths registered weekly in England and Wales, deaths notified to the Care Quality Commission, care home resident deaths registered in England and Wales.
Yes.
Did the ONS expand to produce an ever-increasing list of surveys from, as I've mentioned, clinically extremely vulnerable people, international arrivals, students, attitudes, the care home study, the Vivaldi study, which you've already mentioned, the Liverpool mass testing study, the over-80s vaccine studies, and so on?
Very much so, and always in response to questions that we were being asked and which we could provide insight. And also, for example, we did one on prisons with the Ministry of Justice. We worked in partnership so that our contribution was often methodological and data collection, always working with experts to make sure that the content was appropriate.
Would it be fair to say that by the end of the pandemic, the ONS, along with other bodies, provided a vast amount of data concerning the impact of the pandemic? And were there a number of other studies which may therefore lead one to conclude that the United Kingdom led the world in the provision of data, from the REACT study, the SIREN cohort study, the COMIC surveys, the recovery trials? There was a vast amount of information by the end.
I think it's arrogant to say we led the world, but certainly we did many things that other countries didn't do, and I can't think of another country that was in the same place. And certainly,
well, that's my definition of leading. All right. The ONS did not, as a general rule, produce statistical models, did it? So did the ONS play any part in this provision of data by SPY-M and SPY-MO, to which you've already referred?
We really worked hard to make sure that the statistics that we were producing and which were informative to the excellent mathematical models that were being produced in a number of centres were available as quickly as possible. So we did not produce mathematical models ourselves, with one exception, but we provided statistics and made sure the data that were required were available as quickly as possible.
And now, just some final very short topics before we turn to the charts. Did the ONS provide directly the information used by the government in the press conferences which were held by the United Kingdom government?
We didn't always provide the information. We did, as I've indicated, really work hard with having a team embedded to make sure that the production of the graphs was of the highest standard to be able to communicate to the public what was going on. Not all, the data weren't all ours, but we certainly, if you like, drew most of the graphs.
On the subject of devolved administrations, did the information that was provided by the ONS cover data drawn from the devolved administrations?
In some part. So, for example, the COVID infection survey was designed UK-wide. It started in the different devolved administrations at different times, but it was a UK-wide survey, as was the opinion and lifestyle survey to which you have referred in the past. Other public health data are devolved, and so those were provided by, for example, Public Health Wales or the associated institution in Scotland or Northern Ireland.
Did you provide data mortality data by way of weekly provisions of material, weekly extracts to Public Health England, the Joint Biosecurity Centre, SPY-M, Public Health Wales, Welsh Government, and a number of other national and devolved bodies? You refer in your statement to pandemic challenges and lessons learned. You've made the point already that the ONS was keen to become engaged from an earlier point as possible, and in order to be able to provide data to assist the government. And you say that you did establish excellent working relationships with the government in all its many parts. But do you advocate in your statement for the ONS to be involved in any future crisis at as early an opportunity as possible?
Absolutely. I think it's incredibly important. I also think that the National Situation Centre, with whom we have very good relationships, which identifies some of the national risks, needs to have data flows ready, and we need to be prepared absolutely at the beginning to get those data flows flowing. So I think the ONS needs to be involved right at the beginning, and we stand ready to do so.
You also established excellent working relationships with the devolved administrations. But did the ONS become involved in terms of the provision of data from the devolved administrations and to the devolved administrations at an earlier stage as you would have liked?
In exactly the same place as I've just said. I think we should be involved. I have very good relationship with the chief statisticians of Scotland, Wales and Northern Ireland, and I do think they should be properly involved at the earliest possible stage, and where appropriate, the ONS stands ready to help.
You referred earlier to the conceptual, methodological and practical difficulties of assembling data and of accumulating information from the general population. But were there particular challenges in receiving data from others by way of the application or on account of the application of control of patient information notices?
Well, very quickly, I do think sharing data or being able to link data together, I've already given one example, has the potential to provide evidence to improve the lives of all our fellow citizens in a way that almost nothing else does. And that requires easy, ethical, privacy-enhanced data sharing. Now, there's no legal impediment to data sharing, but there are, if you like, an inherent cultural and conservative issues about, I'm a bit worried about sharing my data, people would say. I do think during the pandemic we were able to make progress in a way that we were not able to make progress before, and the control of patient information rules were very helpful, although I would have to say on occasion it took some months longer to get access than one would want. Most recently, though, with those stopping, and it does seem to me not to be helpful if we can do some really important work, shall we say, on COVID, and you want to do almost the same work to look at cardiovascular disease, we can't do that. Because control of patient information were about COVID. And so that is why Sir Chris Whitty and Tim Ferriss from the NHS and myself have asked Professor Cathy Sudlow to do a review of the barriers to data sharing in health, because there are just so many things that we can do in the future, we would argue, ethically, privacy enhanced, with public engagement, but critically in the public interest. And I think we need to be able to do that better.
So is it your view that in future it's of vital importance to, in order to enable the swift, efficient flow of data through the ONS, that the legal and ethical and medical structures which are in place, which guide access to data, such as the control of patient information notices, are made as well as swiftly and as easily as can be to operate?
That's absolutely right, and it's not just about the data sharing. The Royal Society's Delve Committee suggested that an analysts with the right skills could be, if you like, given a license to enable them to access data quickly. And that was something that we would agree with. My colleague Alison Pritchard calls it, we need a green channel, with the analogy of customs posts. And we are very much in favour of that. But again, when I talk to data owners, they are not so keen, because they are very keen to, if you like, only allow access to certain people for certain projects, when actually, as I repeat, ethically, privacy enhanced, with public engagement, for the public good, entirely transparent, we could make an enormous amount of progress very quickly.
It appears axiomatic that the ONS must be seen as a trusted voice in the United Kingdom, that the provision of data is carried out with the greatest care possible in order to ensure that it is received and understood to be accurate, so that we may all understand where we stand.
We do not believe that it is for the public to trust us. It is for us to prove to the public that we are trustworthy. And that's a distinction that I think is important.
On this subject of trustworthiness of data, did the chair of the United Kingdom Statistics Authority, Sir David Norgrove, have cause to write to the then Secretary of State for the Department of Health and Social Care, Matt Hancock MP, on the 2nd of June 2020 about this issue of, we'll all recall, the testing data, the announcement by the government that it had reached a certain number, 100,000 in fact, tests.
Yes.
What was it that caused Sir David Norgrove to have to write to Mr. Hancock?
Sir David wrote to Mr. Hancock because there was a lack of operational clarity in the data that were being provided as to whether we were talking about tests that people had taken or tests that had been sent to people, or indeed the testing capacity. And Sir David said that it was incredibly important that we had clarity on exactly what was meant, because the public would have rightly wants to know, is this tests that have been taken or is it testing capacity? Sir David met with Matt Hancock. I was not at that meeting, but I understand it was a very good meeting. Sir David suggested that there should be a protocol to publish regularly testing statistics. Matt Hancock agreed, and Sir David came back to me, and I asked my Deputy National Statistician, Ian Bell, to develop that protocol, and it was produced and used.
Thank you very much. Milady, is that a convenient moment?
It is. We've been going for an hour and a half since the last break, so I think a break is probably welcome to many. I shall return at 1:45. All rise. Keith.
Professor, we turn now to your additional witness statement and the particular data sets that you've kindly provided dealing with such issues such as mortality, excess deaths, infections, long COVID, and the social impacts of COVID-19 on particular groups. You provided for us, could we have please page 5, an executive summary which broadly encapsulates, does it not, the charts, the tables and the data which follow. Just to run through them, please, one by one. At A, what is your finding in relation to the figures, the data taken from the death certificates?
That there were 186,668 deaths involving COVID-19 between March 2020 and February 2022, and for the reasons that I've indicated earlier, there were no death registrations involving COVID in January or February 2020. And we calculate something called excess deaths, where we look at the number of deaths in any time period over and above the average in the previous 5 years. And we would say that during this period, there were 138,909 excess deaths. In other words, deaths over and above that which we would have expected, all things being equal, in that period.
B, do the death certificates provide the sex of the deceased, enabling you to work out mortality rates between men and women?
Yes, they do. And we demonstrate a marked trend that men were more likely, sadly, to have been impacted than women.
And were mortality rates, as we all know very well indeed, highest in the oldest age groups?
Very much so, I mean, significantly so. And of course, that, given that with old age comes an increasing probability of disability, the two are quite interlinked.
C, did 9 out of 10 deaths involving COVID in England occur in a hospital or care home?
Yes, they did.
What about the position with private homes? Generally speaking, were the numbers of deaths in private homes quite small?
From COVID-19, so around about, we would say 40% or 30% of deaths occur in private homes. But with regard to COVID deaths, this was around 6%. So most people who sadly died of COVID would have done so either having gone into hospital or were in a care home.
And of course, they could have acquired or become infected with COVID either before or during their residency in hospital or care.
Exactly so, and there was a lot of discussion over the period, certainly of the first couple of waves of nosocomial infection.
D, did the majority of COVID-19 deaths in England occur among disabled people?
Yes, and that, again, as I indicated, was due to the association between old age and disability.
Was that link between disability and old age and death prevalent or in existence, even after accounting for factors such as socioeconomic and demographic characteristics and vaccination status? E, having applied a higher aged standardised approach, what is that succinctly, please, Professor?
What we do is we look at the mortality rate, that's the number of deaths divided by the number of people to whom that could have occurred, but we then control to make sure that we are comparing, if you like, apples with apples by saying we will have one age distribution, because if the people in one occupation were all in their 20s and the people in another occupation, I exaggerate, were all in their 60s, then you would expect it was the age distribution that was impacting that rate rather than the true difference. And so we control in what we call an age standardized rate for differences in the age distribution of people with different, in this case, occupations.
And does that approach also apply, and did you apply it to other categories of groups such as age groups? Because there happen to be fewer 90-year-olds in the population than there are 60 and 70 and 80-year-olds. And so if you produce a chart showing the absolute numbers, it's not in fact representative of the degree of death in that cohort.
No, that's right. If you look at absolute numbers, simply tell you the numbers you need, I would suggest to use rates, and those rates can either be what we call age specific, so for a particular age, but if you want to compare two sets of characteristics, then you need to standardize the age distributions so that you are comparing like age distributions.
And did that age standardized approach demonstrate the mortality rates were higher amongst groups associated with transport and mobile machine drivers and operatives and elementary administration and service occupations? And we'll come back a little later to describing what those were.
Yes.
F, many people reported ongoing symptoms after infection known as long COVID. Did your data show the highest rates of self-reported long COVID amongst adults aged 35 to 69, also amongst women, and also those living in more deprived areas and amongst disabled people?
Yes.
Right. Now, just moving quickly through some, I promise you not all of the charts and the tables that you've provided. Could we have, please, the first page of the document I produced during the opening, the inquiry pack 283367. Professor, this chart is familiar to us. It's a chart which I introduced earlier during the opening. Does it show, in essence, the particular nature of the waves, wave 1 and what you describe as wave 2?
It certainly gives you daily deaths by those first two waves. What I would also add is it shows that in subsequent waves, there was much lower mortality.
Now, you've actually described in your statement the emergence of alpha and delta. Alpha was, generally speaking, from January 2021 to June 2021. Delta was June 21 to January 22. What was the impact in general terms of those two waves upon daily deaths?
Well, alpha, as the graph in front of you shows, had a really significant peak of daily deaths. There was then beta, which, although there were a number of multiple introductions, didn't really take hold in this country, and then delta came in the autumn of 21, and while there was a significant amount of positivity, you will see that there were much lower levels of mortality. We have said, that as the different variants came through, they tended to be more transmissible, but less likely to cause death. But at the same time, by Delta, the vaccine program had really been operationalized, and I would argue that the vaccine program also had a strong impact on reducing the number of deaths. It's worth saying that the level of positivity in the autumn of 21 and the winter of 21 was much higher than we had seen before.
Daily deaths is, of course, one way of examining the impact of the pandemic. Another way is reported infection. Could we have page 5 of this document? Because in the early stages there was no effective means of reporting infection, because there was no established scaled up testing process, does this chart, which reports infection, show therefore very low levels of reported infection during the early days, the first wave, and only really showing the full extent of the infection latterly?
Yes.
Page 6, the next page, is that an ONS infection survey which estimates the true level of infection by way of estimates of positive tests, but again it relies upon the positive tests, and showing the massive impact of the Omicron wave latterly.
Exactly so, and I would note the arrows on the left, which were when the surveys for different countries started.
Could we please turn to page 12 next of your second statement? That's IQ 436. And table 3. Did you apply the age standardized approach to the mortality rates for deaths involving COVID by lockdown periods across the United Kingdom by reference to males and females?
Yes.
And is that the genesis, therefore, of your executive summary to the effect that the pandemic impacted to a considerably greater extent upon males than females?
Yes.
In, please now, the document prepared over the weekend, the pack, does this show the number of death registrations by 5-year age group? So,
yes, it does. In addition, it shows the age-specific mortality rate, which I referred to earlier, so that you have both, and it shows very clearly that, very sadly, the great majority of deaths occurred to older people.
did you apply the aged standardized approach to the bar chart, or is that absolute
No, the bar
figures,
chart,
or to the dotted line?
No, the bar chart is just the numbers of deaths. The dotted line here is the rate for each 5-year group, and calculated and reported, and then a curve driven through it.
And does this chart therefore enable you to work out the greater risk of death at, for example, 90? Because if 0.3 persons per 100,000 people at the age of 13 died from COVID, that can be compared to the number of persons per 100,000 persons at the age of 90, working out that there was a 10,000 or so greater risk of a 90-year-old dying of COVID than a 13-year-old.
Yes.
The next chart I want to take you to, please, is back in your statement, the additional statement, table 5. does this show, Professor, death registrations across the whole of the United Kingdom, but divided by country and region, showing, again, the age standardised mortality rate for each of those regions, as well as each of the nations, page 15. So
Yes, it does.
So the United Kingdom has an age standardised mortality rate of 143.2, but the highest country in the United Kingdom is actually England at 145,
Yes.
followed by Wales at 144.6, Northern Ireland at 130.7 at the bottom of the chart, and Scotland at the lowest.
And I would advise that particularly between England and Wales, that the difference is not significant enough to be seen as a difference.
But if you look at the regions, we can see that there's a very significant difference between the age standardised mortality rate for London at 192.1 and, for example, Yorkshire and the Humber 151.4.
Yes,
And more markedly even than that, the southwest.
yes, very much so. And I think it is important just to add on that particular point, the southwest does have the older population, and I think it is worth saying that's why we need to age standardise the rates.
Going now to the pack, INQ 292765, and your evidence earlier on the distinction between death in homes, hospitals, care homes, and other places, does this chart, when we get to it, page 5, demonstrate what you were saying earlier, which is that the majority of deaths occurred in hospitals and care homes, taken together. We can see there the blue line for home, the orange line for hospital, and the grey line for care homes.
Yes, it does, and it shows a number of points. You will see a very big peak for care homes in that first wave, and I think it's really important to note that. Secondly, the two peaks that are there for hospitals, and that moves away as the vaccine programme comes in. Thirdly, that in private homes, the number of excess deaths stays high throughout the period. And while there are a variety of reasons for that, it is important to point out cardiovascular illness as being very high, as causing deaths in private homes over and above those we would have expected. The expectation...
Sorry to interrupt, because this is, of course, I emphasise the number of excess deaths.
These are excess deaths.
Not deaths from COVID.
Not at all. These are excess deaths from all causes. 0 means the number of deaths would be the same as we would have expected from the previous 5 years for that particular week, and a positive number more, a negative number actually, the less than we might have expected.
And why, in your view, does the orange line for hospital go below the absolute line of 0 in the summer of 2020 and the early part of 2021?
There are a number of potential reasons. One reason, of course, is that people were being somewhat more healthy. For example, we didn't have a flu season, as it is called, in the second winter. In addition, it's very sad to say so, but some of those people who died from COVID might subsequently have died in hospital anyway. And this is very sad to note that. But it is hard to give an authoritative view. There are many potential reasons why that might have come, and one would need to look in much greater detail at the causes.
All right. Could we then go back to page 2 in this document? which gives us age standardised mortality rates of death involving COVID-19 for those aged 10 to 100 years by ethnic group and sex. And does this show that once you apply the age standardised approach, therefore taking account of the absolute numbers in the population of persons defined by ethnic group, the age standardised mortality rate was significantly higher for, firstly, all non-white groups than the white British group, and secondly, it was highest overall for those of Bangladeshi ethnicity.
I would just qualify that briefly, if I may. You're absolutely right. But in the first wave, the highest group was actually for people from Black African and Black Caribbean backgrounds. And I would argue that some of that explanation could be due to the geography of the first and second wave. The second wave was much more in the northwest and north of England, and less so initially in London.
And it shows, of course, therefore, also the very distinct differences between the impact of the waves. So yes, for those of Bangladeshi ethnicity, there's a very stark difference between the first and second wave and then the alpha wave, and similarly in relation to those of Pakistani ethnicity. And there's then also, you can see the very distinct difference between male and female.
I completely agree.
Had the ONS carried out previous analysis in relation to ethnicity and the impact of the pandemic?
This was the first analysis that we did, and we did it by linking, these data come by linking death registration to 2011 census data to be able to get ethnicity. We then subsequently linked in other data to be able to ask the question of the extent to which these stark differences could be explained by different ethnic groups as a group. I mean, clearly there's heterogeneity flying around, but as a group, living in more disadvantaged surroundings, being more disadvantaged in more socioeconomic occupations, for example, which were much more likely to be public facing, where the degree of positivity would have been higher.
Was the ONS able to draw any general conclusions, therefore, as to the link between ethnicity and socioeconomic conditions? So, putting it another way, that the mortality rate was therefore affected not simply by the fact of ethnicity, but by the socioeconomic conditions, deprivation, housing, or poverty experienced by members of that particular ethnic group.
The socioeconomic conditions, the lower levels of advantage, also, as I indicated, for those who were of working age, the higher likelihood to be in public-facing occupations. In addition, we showed that for women of some ethnic heritages living in a multi-occupying household had a real impact. And then the other point we note as we move into the later waves was differences in vaccine uptake played a real role in the probability of mortality.
Could we go back, please, to page 3 in this document? Did you, in fact, produce data showing mortality rate, therefore, by deprivation?
Yes.
And the greater degree of deprivation, the greater the mortality rate.
What we do is we use a number of indicators which we add together for small geographic areas, and then we link the death registration to the geographic area. And as you indicated, we've got address that we can get from the death registration. And what that shows is a very straight gradient between people in the most deprived areas having the highest levels of mortality and people in the least deprived areas having the lowest. And as you rightly say, these are standardized so that we control for differences in the age distribution which may occur between those areas.
If we then go forward one page to page 4 in this document, did the ONS also provide, by way of self-reported information, by disabled persons describing whether they were limited a lot in their disability or limited a little in their disability, on the mortality rates by disability status?
Yes, we did, and this graph shows that. I would just add that if anything, it might be an underestimate because this is self-reported disability from the 2011 census, and therefore it is possible that people may have become disabled in the interim period.
If we could then go, please, back to your second statement, INQ 271436 at page 34, we come to the issue of occupation group. You'll recall that you referred earlier to protective service occupations and other operatives, transport and mobile machine drivers and operatives. Applying the age standardised mortality rate approach, were there some occupations which had a markedly higher mortality rate and therefore by implication a higher risk of death?
Yes, there were, and these tended to be public-facing type jobs. So, for example, when we talk about transport, we're talking about taxi drivers and bus drivers.
Could we go forward one page, please?
And
we'll see transport and mobile machine drivers and operatives at 82.
And when we talk about protective services, that's largely the police and security and things like that.
So thank you for highlighting 82. The highest standardised rate was for transport and mobile machine drivers and operatives at 78.7. By contrast, if you go back one page, health professionals, health and social care associate professionals had lower rates of mortality at 22.2 and 32.6. Why do you think that they had an age standardised lower mortality rate, even though they were in the health and care sectors?
What we show is that they had a relatively high rate of contracting COVID in other data, but that the relatively lower levels of mortality at this stage, I mean, I'm a statistician, so I apologise if my knowledge of epidemiology is not brilliant, but in many ways, better protection, much higher levels of vaccine uptake would be and early vaccine uptake would be important factors.
And what about barrier care? So the more prevalent use of PPE and so on?
That's certainly an impact, but as I indicated, there were relatively high levels of COVID uptake amongst some health professionals.
So there was a high risk of infection, notwithstanding the use of PPE.
Yeah, you have those in another table.
But the levels of mortality were lower,
relatively low,
perhaps because of a greater take-up of vaccination.
So.
Could we go, please, to page 10 in this document? We then come on to the sorry, not in that document, I do apologise, in the PAC document, INQ 2N2765. Did the ONS produce for the inquiry, in fact, over the weekend, some international comparisons? So it's page 10 of this document, please. Thank you. If you could scroll out so we can get the whole chart. International comparisons between a number of different countries showing where the United Kingdom is in terms of all-cause mortality, that's to say all deaths, not just COVID, but also the difference between the numbers of excess deaths during the pandemic and the pre-existing position.
Yes, these are from a publication that we have put out and which uses, again, a standardised population, so we control everything to a standard European population. And what it shows, and I would concentrate on it's ranked by the blue dots, and what it shows is the relative, the proportion to which the mortality rate for a particular country was bigger than the average. And what you see is that in Central Europe in particular, and then in Italy, the rates were much higher. And then largely in Scandinavia, the rates much, much lower. The other point I think it is important to refer to on international comparisons, which we report in a number of publications, is that the UK, particularly England, was one of the very few countries in the first wave to have a national epidemic. So if we were, for example, to look at Italy, Italy had much higher levels of mortality than we did around Bergamo in northern Italy, for example, but almost none at all in the south of Italy. The same in France, where we show that the French first wave epidemic was largely around Paris and Strasbourg, whereas in England, the epidemic came right the way through the country. And that's why I do think what we have reported elsewhere in a series of papers is we divide areas into what are called NUTS, N-U-T-S regions. That's regions of around about 200,000 population. And when we do that, we are able to see much closer the granularity of mortality. And in those data, we show that regions or areas, for example, in London, that the highest in the first wave was Brent, that those areas are regions are a much better level of granularity to look at than nation states.
All right, that's very helpful. And you should make clear, shouldn't you, Professor, that this is a chart of comparative excess deaths. So all these countries have produced excess death figures that you've been able to draw upon. But of course, the rates of mortality in any given country will depend on a multitude of factors, yes, such as population age, resilience, socioeconomic conditions, health, and so on and so forth.
That's right, which is why we have controlled for the age distributions.
And if you wanted to compare the UK with other countries, this would be a better way of doing it because we don't know how other countries necessarily recorded deaths from COVID.
Exactly so.
Yeah.
There is some variation in the recording, and that is why we have always used excess all-cause deaths. And you can see, particularly in the first wave, a very strong correlation in England between excess all-cause deaths and reported COVID deaths.
At pages 8 and 9 of that document, finally, do you produce figures, thank you, for Glasgow, Edinburgh, Cardiff, Belfast, and the United Kingdom average, and then changes in mortality rate in England, thereby showing the different rates of mortality across the United Kingdom and across England?
Yes.
And do they show, in relation to the top chart in general terms, a broad similarity of line, of graph, reflective, of course, of the waves? But if you go to the bottom chart, please, that's to say page 9. We can see, in relation to October 20 to February 21, for London, a very considerable dip during that period, and also between October 20 and June 21, relatively speaking, much higher figures for Birmingham than for the Manchester or London areas.
That is right, and that speaks to the point I made earlier about geography, where the first wave very much, right across, but in London in particular, the second wave in that autumn of 2020, you may recall the outbreak in Leicester, you may recall some of the outbreaks across the northwest, very sadly, and indeed that crescent, which more or less starts in Liverpool, goes through the north and then down to Leicester, was very much where that second wave came, and that is reflected by London having a relatively lower level there.
That wave or crescent of mortality sweeping through that part of England, is that in any way redolent of past infections or disease
Yes,
rates?
if you were to look at, if you were to look at a map, if you were to make a map of the geography, shall we say, of infant mortality in the 19th century, it would not look unlike that, I would have to say. So we have parts of our country that have long-lasting levels of ill health and everything around ill health.
You finally address in your statement the issue of long COVID. I've already asked you some questions on that, but at page 7 of this document, do you produce figures for persons estimated to be experiencing symptoms of long COVID, showing the absolute very large numbers of persons estimated to be suffering from long COVID?
Yes, we do. This slide shows people experiencing symptoms for at least 4 weeks. We also publish data which shows people experiencing symptoms for at least 12 weeks. And the point I would like to make is that as we get closer to where we are now, the difference between people suffering for 4 weeks and 12 weeks becomes very, very small. In other words, people who are experiencing, very sadly, long COVID are experiencing it for a long time.
And are continuing.
Exactly so.
Thank you very much. Professor, those are all the questions that I have for you.
I think I have provisionally agreed, and I confirm, Mr. Weatherby, you have some questions, I think, followed by Ms. Shepherd thereafter.
Thank you very
Mr.
much.
Weatherby.
Thank you. Professor, I ask questions on behalf of the COVID Bereaved Families for Justice group, which represents many bereaved families from across the UK. Just a few questions, and I'm going to return to a point that was touched upon before lunch by Mr. Keith, and that's some correspondence between Sir David Norgrove and Matt Hancock. So Sir David was the chair of the UK SA, you are the chief executive, Matt Hancock at the time, Secretary of State for Health. Mr. Keith touched upon a letter of the 2nd of June of 2020. It's right, isn't it, that was a published letter, and you're aware of it?
Very much so. That is the policy of the chair.
Yeah.
If there is an issue that wishes to be raised, then a public letter is written.
Openness and transparency.
Exactly.
Yeah. And I'm going to put it up in a moment, so I'll just give the reference, but I don't need it up quite yet. INQ 000 237 314. Now, for the reasons of time, we haven't included the chain of the correspondence, but this is a letter of correspondence that started on the 11th of May of 2020, and each of the letters, as you've just helpfully explained, and the responses are published on the UK SA website, and they're there to be seen. And again, for context, the correspondence was regarding Mr. Hancock's 100,000 tests per day target by the end of April for testing, and 200,000 tests per day target by the end of May. So that's the context. I'll take you, as I say, to the key passages in a moment, but the correspondence that culminated in this letter was raising significant concerns about the government's presentation of the testing data, wasn't it?
Yes.
And it's significant, isn't it, that the chair sought to write to the Secretary of State. That underlines how important this was.
We saw, Sir David saw this as a really important, that the public were fully aware
Yeah.
of accurate data that were transparent, to use your words.
Yeah. Thank you. Let's just go to the key parts of that, if we may, if we can just have it up on the screen. And the first page, bold type, Sir David Norgrove's response. So that indicates it's part of this correspondence, and it's dated the 2nd of June. And then the second page, if we can jump to that, please, is the subsequent. So I'm just going to read the start of it. I'm not going to read the whole letter out. But Dear Secretary of State, thank you for your letter of the 27th of May, in which you describe some welcome, though limited, additions to the official data on COVID-19 tests, including a proposed note on methods not yet published. I'm afraid, though, that the figures are still far from complete and comprehensible. Statistics on testing perhaps serve two main purposes. The first is to help us understand the epidemic alongside the ONS survey, showing us how many people are infected or not, and their relevant characteristics. The second purpose is to help manage the test programme to ensure there are enough tests, that they are carried out or sent where they're needed, and that they are being used as effectively as possible. The data should tell the public how effectively the testing programme is being managed. Yes? And then this. The way the data are analysed and presented currently gives them limited value for the first purpose. The aim seems to be to show the largest possible number of tests, even at the expense of understanding. It is also hard to believe the statistics work to support the testing programme itself. The statistics and analysis serve neither purpose well. Yes? So I'll read on in a minute, but where we're up to at the moment, Sir David is highlighting the proper purpose of the data. Yes?
I would suggest that Sir David's letter is clear and comprehensible.
Yeah. Thank you. And he's pointing out that the way it's being presented to the public is not fulfilling either of those purposes, but is being used for another purpose, to simply show the largest possible number of tests. Yes? That's clear and comprehensible from that section.
That's what Sir David is saying.
Yeah. And you agree with that?
I think it's a fair statement.
Yeah. I'll just read on slightly further to mention just a few issues. Just the first bullet point there. The headline total of tests adds together tests carried out with tests posted out. This distinction is too often elided during the presentation of the daily press conference, where the relevant figure may misleadingly be described simply as the number of tests carried out. There are no data on how many of the tests posted out are in fact then successfully completed. The slides used in the daily press conference do not show the date when the tests were carried out. So am I right that in fact what's happening is that the number of tests that is being presented to the public is misleading because it adds two different pieces of data together?
That's what Sir David is saying.
Yeah. Jumping to the third bullet point, just the last sentence of that. The consequence, or one of the consequences, this presentation gives an artificially low impression of the proportion of tests returning a positive diagnosis. So on the one hand, there's an inflated figure of the number of tests carried out. And one of the consequences is that there's an artificially low impression of the actual positive diagnoses.
That's a reasonable, it assumes that those tests that weren't carried out will have the same probability of a positive test as those that were carried out. So there's an assumption in the arithmetic, but the arithmetic's absolutely right.
I follow that. But that's the two effects that Sir David is trying to get over. And then jumping to the third page, finally, just two short passages from there. and it's the paragraph below the bullet point. I warmly welcome, of course, your support for the Code of Practice for Statistics. Now, that relates to earlier correspondence where the integrity of statistics had been made clear between the two of them. But the testing statistics still fall well short of its expectations. It is not surprising that given their inadequacy, data on testing are so widely criticised and often mistrusted. So here Sir David is making clear to the Secretary of State how very important this matter is. Yes?
Yes.
And finally, the final, just for completeness, final paragraph. I do understand the pressures that those concerned have faced and still face, but I'm sure you would agree that good evidence trusted by the public is essential to success in containing the virus. Yes?
Absolutely.
And you'd agree with that?
Yeah.
Yes, thank you very much. That's all I want to ask.
Thank you, Mr. Wetherby. Ms. Shepherd.
Before we came into court, I understand that those who represent FEMHO wanted to ask some questions. I'm happy for them to go first, and if we've got time to come to me.
I don't think I've given...
May I assist?
Oh.
Mr. Thomas KC approached me during lunch and said, would I go back to the issue of Professor Diamond's evidence where he said there were good reasons for not having ethnicity on registration of death certificates, and he wondered whether we would return to that issue. I indicated on account of the time that I probably wouldn't. So I suspect that what he's really doing is making a Section 10(4) application ex post facto in order to return to that point.
I'm happy to briefly.
Well, can you explain the reason? You said there was good
Yes.
reason for not...
Well, this is my view is that you should minimise what is on a death certificate for the very simple reason that the person who most understands the answer is sadly no longer with us, and therefore you are going to have errors coming into the data that you cannot control for. That is why I am completely in support of the current proposals that are being made around the legislation, which will bring ethnicity using the full census definition or census categorisations into National Health Service data, and then those National Health Service data can be lifted into death registration using the kinds of linkage that I've talked about before, and that will give us absolutely top-class data. So just for clarity, I am very much in favour of having ethnic differentials of mortality calculated and published regularly, and we at ONS would very much like to do that, but I just think it is better that the person who sadly is no longer with us has the opportunity to provide that information, and then we add it later rather than we try to bring in errors, data that can be subject to errors that we can't control.
Thank you. I hope that answers FEMHO's questions.
I believe it does, Madam.
Thank you very much. Ms. Shepherd.
Thank you, my lady. Professor Diamond, I appear on behalf of COVID-19 Bereaved Families for Justice Cymru. You've already been asked by Council to the inquiry about the extent to which ONS data were gathered from the devolved administrations. I want to ask specifically about the COVID-19 Insights tool, which was for the benefit and information of the public. Were data from Wales or any other of the devolved administrations incorporated into this tool?
Thank you for that question. The answer is yes, they were. Where they were incorporated directly where ONS collected the data in a UK-wide basis. So the Coronavirus Infection Survey, the CIS that we've talked about previously, and the Opinion Survey, which we've talked about previously, collected UK-wide data, and and the data were made available through that tool. Where data were collected explicitly in a devolved administration, for example, some of the mortality data, we provide on the Insights tool a link to where you could get those data. So if you were interested in Welsh data, there is a link to where those Welsh data are published, but we do not publish them if you like, as one UK-wide data.
Thank you, Professor, and thank you, my lady.
Thank you, Ms Shepherd. Thank you very much, Serene. It's very kind of you. And I won't say I got excited by the statistics. I can never say the word, but you certainly made it extremely interesting and very informative.
Well, thank
I'm
you.
very
It's been a
grateful
huge
to you.
privilege. Thank you.
Well, and also I heard a number of references by Mr Keith to work done over the weekend. I hope we haven't imposed too great a burden.
We
on you.
always work over the weekend at the Office for National Statistics.
Good
Thank you
advert.
so much.
Yeah, well done. Thank you. Mr O'Connor.
My lady, may we now please call Gavin Freegard?
Yes, please.
Hello there. If you'd like to repeat that to me. I do solemnly, sincerely and truly declare and affirm that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth. Sit down.
Could you give us your full name, please?
Gavin James Freegard.
Mr. Freegard, you have kindly prepared a detailed report for the inquiry on the subject of data processing and the use of data in government during the COVID pandemic. We have the first page of the report on screen. You can see it there. And we can see that just above your name and the date, you've included a statement explaining your understanding of your duties as an expert, and you've indicated there that the detail within the report is true to the best of your knowledge and belief. Is that right?
That's correct.
Mr. Freegard, you are currently a freelance data consultant, I think.
Yes, that's right. I tend to work on data policy, research and advocacy, and also focus on digital government as well.
Thank you. You've set out in your report, we don't need to look at it, a range of roles that you undertake at the moment, including that you are an associate at the Institute for Government and also a special advisor at the Open Data Institute.
Yes.
And you've also indicated that prior to undertaking freelance work, you were in fact an employed researcher at the IFG, holding the post latterly of Programme Director for Data, Transparency and Digital Government.
Yes, that's right.
Mr. Freegard, as I've said, the focus of this report, which I should perhaps have said is a lengthy one, it's 70 or so pages long, it is to do with data matters and how they affected the taking of core political and administrative decisions during the COVID pandemic. And you are aware, because these were all part of your instructions, that the list of issues for Module 2 of this inquiry relate to matters such as identifying the key sources of data available to decision makers, yes?
Yes.
Questioning whether decision makers had access or adequate access to reliable data, statistics and so on. Asking to what extent the data collection during the pandemic addressed the impact of COVID-19 on vulnerable and at-risk groups. And finally, addressing the question of the adequacy of sharing of data within government structures during the same period. And all those matters are addressed in your report, are they not?
They are, yes.
It's right at the outset to make it clear, as you do in your report, that your expertise in this field is very much focused on matters relating to Westminster government and institutions. So as we know, we were addressing devolution matters yesterday. That covers matters relating to England and the UK, but you've explained in your report that your expertise doesn't really extend to similar matters within the devolved nations, Wales, Scotland and Northern Ireland.
That's right. I occasionally touch upon that in my report and think it's an extremely important topic, but my work has been focused on Westminster and Whitehall.
So you've fairly made the point that you can't help us in an expert way with those matters. And just finally, by way of introduction, it's important to make it clear, and for the sake of those who go to your report, which we will of course adduce in evidence in full, that you were at the outset instructed to prepare this report on the basis of your own understanding of these matters and materials that were publicly accessible. You weren't provided with the very considerable amount of evidence that we have now obtained. The reason for that being you were instructed before we had all the evidence. You have latterly seen some of the evidence that the inquiry has obtained, and we'll look at some of those documents together. But any reader of your report should not assume that the judgments you express in the report are made on the basis of a review of all of our material. That would not be right, would it?
That's correct.
Thank you. I want to start then, Mr. Freegard, by some fairly broad summaries of the early stages of your report. You make the point at the outset of your report, and perhaps it's a theme, perhaps the most important theme running through it, that data is a vital tool for policy making, particularly in times of crisis.
Yes, that's right. I think for policy making, in terms of bringing evidence to that, in terms of evidence of what works when it comes to policies that are being implemented, but also to the operational side of government, and I think we see that through the pandemic as well, particularly when it comes to healthcare data.
Yes, thank you. Mr. Freegard, when you answer my questions, if you could try and speak slowly, that will assist all of us, including the stenographer. You explain in your report that in recent decades, the last decade or two of the data revolution, the potential desire for government accessing, sharing, manipulating these very large data sets has grown alongside the availability of data sets of that nature.
Yes, that's right. And my report begins by looking at, I think, around 30 different reports that we've seen since the mid-90s about how government might improve, how it makes the most of some of those opportunities, and also that we've tended not to follow up on quite a lot of those or looked in detail at which recommendations have succeeded and which ones have not, and the reasons behind that as well.
Well, let's perhaps just, I'm certainly not going to take you to all of those reports. In fact, possibly only one of them, Mr. Freegard. But if we go to page 8 of your report, I think it's fairly obvious, even just glancing at the pages. Yeah, so we see you're listing those reports. The earliest, I think, is in 1996. Then if we can just scroll forward fairly quickly through the pages, we can see all of these different reports. Thank you, just if we can keep going. It's a long list, Mr. Freegard, of reports in the large part commissioned by central government, asking themselves questions as to how they can use data more efficiently. And you've touched on this point, but the question is there almost a failing in itself by noticing quite how many reports there are within a relatively short period?
I think so, yes. Again, it's not been for lack of trying. It's not been for lack of interesting ideas about what might need to be changed and what needs to be done in order to change things. But it does feel like we often repeat recommendations. There's some very strikingly similar language, even from the late 90s, that we could find in a report published, in the last couple of years. Government just doesn't quite seem to grasp some of the opportunities sometimes. And I think we're also quite poor at learning from the successes and failures of those different recommendations.
You in your report, you have tried to crystallise some of the key issues that come up, as you say, time and again in these reports. Routine failures in the data field, and if you like, barriers, I think that's a word you use, to data sharing within government. I want to ask you about them just briefly in turn. First of all, you talk about technical barriers, and by that I think you mean interoperability problems, the fact that government perhaps can't speak to itself, or different parts of government can't speak to itself very well, or at least transfer data between areas of government. Is that right?
Yes, that's right. So that often stems from a lack of data standards. So people in different parts of government might be recording similar data but doing it in very different ways, which makes it much more difficult, as you say, for interoperability to compare and collate those various different things. Sometimes the data simply isn't collected, which is definitely a technical problem. But we also have issues of legacy technology where some of the computer systems and some of the data systems that have been in use in government have been in use for many decades. It becomes more and more difficult to extract data from those, or you need much older expertise. And then trying to reform those systems and bring in newer technology becomes more challenging.
So those are the technical barriers. You refer to legal barriers in a few sentences. What do you mean by that?
That tends to be where the law does not provide or is not clear that it provides the sort of locus for different parts of government being able to share or access data. I think that's one area, and you will see this in the sort of chronology of reports, where some of those problems have been tackled over the last decade or so, things like the Digital Economy Act and some of the clarity brought by the General Data Protection Regulation have sort of solved some of those problems, but there are still some challenges with there being a lot of different pieces of legislation that can allow data sharing, lack of clarity about how to make the most of some of those routes as well.
Yeah.
And I think just a final sort of legal issue is, I think because different parts of government are different legal entities, that can sometimes make sharing across those different organisations more challenging.
Thank you. That does, I think, lead into the third of those barriers that you describe, which is cultural and organisational barriers. And at least one of the points that you make in that regard is that, going back to the legal barriers, even if, in fact, as a matter of legality, it is possible to share, let's say, a data set from one part of government to another, you might find that the general sort of, concern about legality of sharing means that there is a sort of an inertia there, and that data sets that might be shared end up, in fact, not being shared. And that's one of the points you make under cultural and organisational barriers of that nature.
That's right. And in a sense, that comes from a very good place. I think that's people within government organisations not wanting to get something wrong. They're quite fearful that they might accidentally share something that they shouldn't be. And it speaks to a need for greater guidance and more support for people that are trying to do that. I think some of the other cultural and organisational barriers that it's worth picking out are that some of this is not about data, it's about the structure of government and the fact that siloed government departments don't tend to work together as effectively as they might, and sometimes the incentives aren't there for different departments to share or make their data available. So, for example, one department might be the one that has to invest in a particular data set. The benefits might accrue to a different department. That will not necessarily be reflected in sort of funding or anything else.
Mr. O'Connor used the word inertia. I wonder if caution might be a better word. I remember when we first had to start dealing with data management with the judiciary, and some extremely able lawyers found some of the provisions quite complicated, and therefore that may have led to a degree of caution.
Yes, I think that's right. And certainly traditionally that complexity, especially when there were a lot of different legal gateways, led to some of those challenges. I think we're also in a relatively early stage still of some of that legislation bedding in, which means some of the legal precedents are still being developed, and perhaps the specialism isn't quite there in all parts of government yet.
And then, Mr. Freegard, the final generic barrier that you describe is political. You refer to other priorities within the political space. Can you expand on that?
Yes, that's right. I think over the last sort of 7 years or so, obviously there's been quite a lot of turnover at the top of British government. I think we've had 12 different ministers for the Cabinet Office since 2015, that being the organisation most responsible for the use of data within government. Things like Brexit, and then of course the pandemic itself have absorbed an awful lot of civil service and political time. And another example of that is the lack of a chief data officer for government. That's something that's been promised at least since 2017, and there has not been a permanent appointment. And again, that sort of role could bring some political focus and strategic leadership on some of the issues that we'll be talking about, and that has been lacking.
Thank you. And I'm going to come back to the point about the Chief Data Officer in a moment, but just finishing then this point, you've referred to those 4 really very generic barriers. Those are points which emerged to a greater or lesser extent in many or all of those reports which we saw flashing on the screen, and those who want to can look at in more detail by looking at your report itself. And we're obviously going to come on and talk about the experience during the pandemic, but is your view that those 4 issues, as it were, also had their part to play during the pandemic?
Yes, that's definitely right. I think as well it's worth saying that the pandemic helped overcome some of those barriers. The fact that there was such urgency, there was such a clear purpose and such a collective purpose from different parts of government meant that perhaps some of that cross-government working happened where perhaps we haven't seen it in the past. Obviously there was a strong political imperative to get things done as well. So we definitely saw some of them being overcome in a way that perhaps we haven't during business as usual periods in government.
Thank you very much. Now, Mr. Freegard, I did mention that I might ask you about one of these many reports, and in fact, as it happens, it's one of those which is shown on the screen at the moment. It's the National Data Strategy. So I wonder if we could just highlight that or enlarge that sub-paragraph in the middle there. Yes, all right, well, we can go. Thank you, there it is. So, Mr. Freegard, that as we can see on the screen, that was a report, a strategy that was published, in fact, during the pandemic, although you make the point that it had been commissioned some 2 years earlier, and I think it had been, it had responsibility for the review, had been passed between government departments during the time it was being considered. But tell us a little about that strategy.
So that came from, as you say, a sort of machinery of government change, and I think a renewed focus on what better use of data could do for government. And it was designed deliberately as a framework strategy, that is, setting some overall missions for the use of data in government, better use of data being based on particular pillars. I'll come back to one of those in a moment. And then there being lots of different activities, specific activities to be conducted by different parts of government underneath that. One of the pillars that I mentioned is probably of most interest to the inquiry about data availability. That is a term that the strategy uses for data sharing, accessing data, finding data more generally. Again, as a framework strategy, it was very much there to be an overarching thing that other parts of government might be able to use the principles from as well. I was at a roundtable last year, a roundtable discussion organised by Civil Service World, which suggested that lots of departments were still looking to some of the principles in the strategy to try and improve their own use of data, although it does feel like over the last year or so it's received less prominence. It's now the responsibility of the Department for Science, Innovation and Technology, and when that was created, this was not one of the initiatives that was sort of highlighted as moving from the Department of Digital, Culture, Media and Sport to DCIT.
Has it, I mean, I don't think it's clear from your list, but has this strategy yet been replaced by yet another review or machinery of government exercise?
It's still there. There are still some teams within DSIT working on particular missions within it. I've spoken to some of them quite recently, and I think, again, the fact that it's a framework strategy with other parts of work mentioned within it means that it's still living in some way. So, for instance, Cabinet Office, the Central Digital and Data Office specifically, is responsible for a roadmap for government data and digital, and that's one of the many parts of the strategy which continues in some way.
So we have roadmaps, we have strategies. Any action?
There is some action. There is definitely action. For instance, Cabinet Office recently have been doing work around data maturity. That's helping different parts of government to understand how prepared they are for doing more work with data.
But let me ask you about a different aspect of action arising from this strategy, and that's the point you made earlier about data officers. First of all, I think I'm right. Well, first of all, it's right, isn't it, that this national data strategy does encourage the appointment of data officers, first of all, within government departments, and then a chief data officer to oversee data within the government generally.
That's right. There's a lot in there generally about upskilling civil servants to work with data, and, as you say, that very specific chief data officer for government pledge.
Just before I'll come back and ask you about the chief data officer, but it's right, as we understand it, that before 2022, so last year, that the Treasury, which is clearly one of the departments that had a large role to play during the pandemic, didn't have a chief data officer at all. I mean, it was only last year that a chief data officer for the Treasury was appointed, no doubt, as a result of this strategy. Are you able to help us with whether that, as it were, was indicative of a lack of control of data within the Treasury before the appointment of a chief data officer within that department?
I think it certainly brings more focus to the use of data within the department, and means that there is somebody who is responsible for thinking about it, which may not quite have been the case before. I think something we find sometimes across government is there may be people playing some of the roles associated with the chief data officer. They may have different names, they may not be quite the right seniority to be able to do anything with it, and that does make the picture sometimes more difficult to understand.
And then what about the chief data officer for the government as a whole? That post still hasn't been filled, as we understand it, despite the recommendation dating back to 2020.
That's right. There have been a few interim holders of that role. There have been a few attempts, I think, since 2020 to fill it permanently, and again, since earlier than that, to try to fill it as well. But as far as I'm aware, I think there is a process that has been ongoing fairly recently, but I don't think an appointment has yet been announced.
I'm going to move on, Mr. Freegard. Thank you for that. You have mentioned briefly in that summary you gave us some of the statutory underpinning of the data world, if I can put it that way. We are all perhaps familiar to a greater or lesser extent with the Data Protection Act, GDPR, now the UK GDPR. You also refer in your report to the Privacy and Electronic Communications regulations in that context as part of the basic underpinning. I'm not going to go to the detail of any of those provisions, but one of the provisions I do want to ask you about is another one you've mentioned, which is the Digital Economy Act 2017. That's at page 13 of the report. If we can expand paragraph 14. It's the provisions, or the provisions of this Act are, I think, one of the areas that you mentioned a moment ago that perhaps hasn't fully bedded down or is not fully understood exactly what functions it serves and the, if you like, the permissions that it grants. Tell us, if you will, what innovation this Act represented.
So the Digital Economy Act of 2017 covered issues beyond those of interest in the inquiry, so things around broadband and digital connectivity as well. but when it came to data sharing within government, did sort of provide powers for different parts of government to be able to share data with one another. And in fact, I think very much a response to some of those many reports that we've already touched on about the lack of legal clarity and around powers for data sharing. So it introduced powers for sharing data through the purposes of digital government and public service delivery. It does not cover sort of health and social care, adult social care provision. So it does cover other purposes, but not those ones. And there is, under certain parts of the Act, a register that is published by Cabinet Office. So we have some insight into some of the data that's being shared across government.
Thank you. So perhaps two important points. One is the general point you make that under this Act there's a freeing up of the ability of sharing of data within government. But important to note, particularly, of course, given our focus on the pandemic, that general liberalisation of sharing of data did not apply to health or social care data. Is that right? Yes. And that sharing of data of that particularly sensitive nature can be done, but there is a special procedure which you refer to in your report. I'm not going to take you to the provisions, but it's the Health Service Control of Patient Information Regulations, which permit a Secretary of State to, as it were, grant specific and very focused permission for the sharing of, for example, healthcare data. In fact, this morning we heard Sri and Diamond talking about what are known as COPI regulations, and I will ask you some short supplementary questions about those in a few moments. My lady, I wonder if that would be a convenient
certainly,
break.
perfect timing, Mr. O'Connor. I shall return at 3:15. All right. Mr. O'Connor.
Mr. Freegard, I want to move and ask you some more sort of focused questions about issues that arose, difficulties that arose in relation to using and sharing data at the outset of the pandemic. And as you've already suggested, it may be that we see represented there some of those generic barriers that we discussed before the break. The first of these is simply a lack of data available on which to make decisions. And for these purposes, perhaps if we can look at your report, page 41, paragraph 79, and we can see, starting 4 lines down, you refer to the well-known decision on the 12th of March 2020 to stop community testing, the Test and Trace initiative. And the very simple consequence of that from a data point of view was that the tap was turned off. And so you refer there to a modeller making the comment, if you're only seeing the tip of the iceberg, hospitalisations, deaths, you don't know how broad that iceberg is. The understanding of the spread of the virus in the community was simply not something that was available as a matter of data at that stage.
That's right, and I'm not sure I can put it any better than that quote from the modeller. Obviously, in order to properly monitor the outbreak and understand how to tackle it, that sort of data is what you need decision makers to have, and the decision to stop testing meant that case data was much more difficult to come by.
And as we heard in Mr. Keith's opening, only a couple of weeks or so later, the discrepancy between known cases of COVID, which had been the subject of tests, and what retrospective estimates of what was in fact the position had grown, a bit like the iceberg, so that there were some 6,000 or so positive test results, but the estimate was that it was something close to 500,000 people were infected by that stage. The data simply wasn't available to inform the position.
That's right.
So that's perhaps one example of a challenge faced. Another slightly different challenge, but which again goes back to those barriers we were discussing, was a reluctance within government or an inability perhaps, to share data that was available. And that's where we come back to the Digital Economy Act that we were discussing, which on the one hand had freed up the sharing of most data within government, but not healthcare data. Thank you, it's paragraph 48 of your report, which refers to the first control of patient information notice being issued, or COPI notice, as we heard Sir Paul Diamond refer to them as. And this was a notice issued by the Secretary of State under these regulations, which in effect put healthcare data into the same category as other forms of data under the Digital Economy Act, although for a very an express purpose and a limited period of time. And I think you refer to the fact that these notices had to be renewed. I don't know if it's every 3 months, every 6 months, something of that nature.
That's right. I think it's worth underlining that the General Data Protection Regulation and the Data Protection Act, it meant that there was the flexibility there for data sharing, including in health, to happen. But from things that I've heard and included in my report, the COPI notices were extremely important in sending a signal across the whole system that it was extremely important to be able to share particular types of health data. And even if I also note that some people were still reluctant, it still took a little bit of time to overcome their caution and to give them that legal reassurance. But it did act, in the words of some people that we interviewed for an Institute for Government project, a badge of honour and a security blanket. It made them feel much safer in being able to share a lot of that health patient data.
Thank you. A further safety blanket, if that's what we want to call it, was provided by the Information Commissioner at around the same time. This is something that you refer to at paragraph 28 of your report on page 17. We haven't mentioned the Information Commissioner so far, but again, I think most of us in this room understand that that is someone who is tasked with enforcing these various data regimes that we're discussing. And is it right that at the outset of the pandemic, the Information Commissioner issued a notice encouraging people to share data?
Yes, that's right. There was a short statement in March 2020 where I think the Commissioner said she would be pragmatic and in how she applied the existing principles to try to get people to share data that needed to be shared. That was something that was welcomed by the National Data Guardian, sort of watchdog for the use of health data, who listens quite a lot to patients. And then as paragraph 28 shows, there was a sort of longer document, though still a short one, in April 2020 that again acknowledged that there were severe pressures facing people in government and elsewhere during the pandemic, and also that data did need to be shared for health purposes, particularly during the early days of the pandemic.
And again, from your assessment on the ground, did this have an effect?
It seems to have, again, as you said, it's another security blanket that meant that people knew that there was some protection there, there was guidance there, there was support there for what they needed to do.
Thank you. I'm going to move on again to a slightly different context, which takes us back to the sort of systemic or technical barriers within government, even if the data exists, even if there is permission to share it. Sometimes the infrastructure simply isn't there to allow that sharing to take place. And for these purposes, yes, it's page 40 in paragraph 75 of your report where I wanted to pick up. And you refer there, we've covered data that didn't exist, but it's the formatting, it's the process issues, and you refer to data flows not having been thought about or tested as part of pandemic preparedness exercises. I'm going to come back to Operation Cygnus in a moment. If we can go on to paragraph 76, you refer to several Downing Street figures having spoken about a lack of developed data pipelines and processes at the start of the pandemic. Data collection and collation was instead ad hoc, with officials emailing and being emailed Excel files, Word documents, making phone calls, writing it down, pulling it together, all very inefficient. Does that seem to have been the process that was taking place in, for example, Downing Street and the Cabinet Office in the early stages of the pandemic?
Certainly at the start, as you can see, Simon Case, the Cabinet Secretary, among those speaking afterwards about the fact that that's how it was working. There weren't those sort of reproducible pipelines, APIs, another way of being able to share data more quickly and more easily. Instead, a very fragmented process of emails, Word documents, Excel spreadsheets, phone calls, people reading off scraps of paper onto whiteboards in Downing Street, rather than having the flows there ready to go. I think in his statement, Tom Shinner expresses his surprise that so much effort had to be put into bringing that data in rather than just being able to enact protocols that already existed.
I mean, you might have to educate us a little bit, Mr. Freegard. I mean, to some of us, the idea of emailing an Excel spreadsheet might feel like a sort of pretty sophisticated technical thing to do, but you're describing it here as something that was not sophisticated enough.
When it's coming from hundreds of different health organisations at a rate of knots, it's much more difficult to keep hold of all of that, having to copy and paste it. We know as well, for instance, Public Health England at one point was compiling its line lists. That is a spreadsheet with a line for each patient from individual emails. A lot of those things should be much more automatic. There should be processes in place where that data is being brought together much more easily, sort of automatically, rather than a lot of effort having to be spent collating, especially in a moment of extreme pressure from all of those different sources.
You've mentioned APIs. We perhaps don't need to get into the detail, but essentially this is a piece of software which manipulates automatically. It's a feed. It's another term you use is a data pipeline. It bypasses the need for any particular person to look at spreadsheets, Word documents, and amalgamate them. It does it all automatically.
That's right. Application programming interfaces, which, as you suggest, allow sort of different computers to talk to one another without the need for all of that copying and pasting.
And there was a reference in paragraph 75 to the fact that these lessons perhaps should already have been learnt. And you refer to Operation Cygnus, which is something that the Chair and the inquiry is familiar with from Module 1 of this inquiry, but it may be that this particular aspect to it is worth emphasising. And if we can go to paragraph 80 of your report, please, on page 41, and picking up 4 or 5 lines down, you say, there are some factors, beside the general ones you refer to at the beginning of the paragraph, there are some factors more specific to the pandemic. Previous pandemic preparedness exercises touched on data, but not in much practical detail. Where they made recommendations, they appear not to have been taken up. One of the best-known drills, exercise Cygnus in 2016, the flu simulation, recommended establishing a cross-government working group to clarify the process and timelines for providing and best presenting data on which responders will make strategic decisions, since participants were unclear about how epidemiological information would be produced and disseminated. In other words, it seems addressing just exactly this point: how is this sort of data to be received and used centrally in the context of a disaster or a pandemic? But you go on to make the point that Cygnus was set in week 7 of an epidemic. Why is that important?
I would hope that you'd be able to get those data flows up and running, or would need those data flows up and running much earlier in the process. And I think it shows that although there was high-level commitment to better data, the thing that was missing was actually thinking about those practicalities. What data did you need to get to which people, and how were you actually going to do it?
May it have been that Operation Cygnus just rather assumed that the data flows would be coming in, but they didn't think about, in fact, whether that would be the case in the event of a pandemic?
Quite possibly. And again, there are other exercises which also thought about what data might be needed, what data might be there. In some cases, it was perhaps not the data that was expected when it came to COVID. A lot of the exercises had been based around different types of pandemic. So there may have been some surprises about what data was available when it came to healthcare in particular. But again, there seems to be that lack of granularity and practicality in thinking about how those flows would actually work.
We may be able to get a fairly practical insight into this by looking at a document known as a CRIP, which was one of the sort of collations of data that was in play in the early stages of the pandemic. So if we could have up on screen, please, INQ 40056187. Thank you. Are you familiar with what a CRIP is, Ms. Freegard?
Yes.
What does it stand for?
Commonly recognised information picture.
That wasn't a very good question, was it? 'Cause the answer was
It's
there
right on screen.
But it's a term of art, is it not, in sort of contingency planning? And CRIPs are intended to be a sort of regular, daily bringing together of the critical information that decision makers need in order to make the decisions that fall for them.
Yes, and I think an attempt to create a single source of truth so that all of those decision makers are really starting in the same place.
And this, we note, is a CRIP dated Wednesday the 18th of March, as we've already heard, but we will certainly come to hear in more detail. That was a critical moment in the early stages of the pandemic. We will hear evidence about the SAGE meeting on Friday the 13th, a few days before, where the true scale of the decisions facing the country perhaps became apparent. Crisis meetings over the weekend. We're in the last few days before the decision to implement the first national lockdown were made early the next week. So it's really a sort of crisis moment. And we can also see, of course, it's CRIP number 28. So this CRIP system has been in play for a little while by that stage. And before we look at the detail, Mr. Freegard, an important point to bear in mind is that this document is, if you like, a static document. Can you explain what we mean by that?
So a snapshot of data at a particular point that will have been circulated and printed out, as opposed to what we saw later in the pandemic, which was something more interactive. So, for instance, the Covid-19 dashboard and the various internal equivalents, which could be updated more regularly.
And we'll certainly come to look at that. So it's a static document. It's simply, it stands for itself, but it's also the case, isn't it, that someone actually needs to populate the various tables and charts or bullet points within the document. It doesn't happen automatically. Someone's got to type in the numbers and the detail.
That's right. With something like a dashboard, the pipelines would be running to bring the data through, whereas, as you say, somebody would have to sit down and paste things in for this.
So it's a relatively short document, 6, 7, 8 pages long, something of that nature. If we just look at the next page, please, we see a situation update. I just want to draw your attention to I think it's the 5th bullet point down at the top. There is an estimated population infected figure there of 5 to 10,000 pounds. 5 to 10,000. Now, of course, we know, looking back, that was a gross underestimate. But that isn't really the point I want to make. I want to, if we bear that figure in mind, 5 to 10,000, if we can just go on to the next page, we see in the 3rd box down exactly the same variable, estimated population infected, but instead of 5 to 10,000, it's 30 to 40,000. So it would seem that whoever was typing in the numbers into the box, or perhaps it was more than one person, perhaps from a different source, we've ended up with a short document with 2 very different figures for the same variable. One might have thought one of, if not the most important variable in the document, how many people do you think in this country have got COVID at the moment? You look at one page, it says 5 to 10,000. The next page, well, it could be 30 to 40,000. This being the document that the Prime Minister is looking at in order to make his decisions. It's quite a striking example, isn't it, of the sorts of problems we were discussing.
It is, and this is exactly what those hundreds of individual Excel spreadsheets or emails or Microsoft Word documents gets you to. It's that people copying and pasting, there not being the right quality assurance around the data that's coming in.
We imagine someone sitting sort of besieged by emails. He's printed some of them off, he's looked at some of them on their phone, and mistakes happen.
Quite.
If we could go on to page 5 of the document, please. Again, one might have thought a rather important page for the key decision-making that was going on, trying to understand what the health and social care situation is in the country. It's quite striking that of the columns which are actually completed, in other words, data is available. One of them is for the percentage of NHS 111 calls answered within 60 seconds. Not, one might have thought, the most important data on which to decide whether to, for example, lock down the country or not. Moving along, we also see full data for the number of urgent operations that have been cancelled. But between those two columns, the area on the sheet for the number of ICU beds occupied, the percentage of ICU beds occupied by COVID-19 patients, and bearing in mind that one of the priorities, if not the priority, that had been identified by the government at that point was protecting the NHS from collapse because of being overwhelmed by COVID patients. No data seems to have been provided.
Indeed, and I think some of the data that you would need to work out the percentages there would actually just be things like the overall number of beds in the system. Even data like that, which should have been easier to come by, was also missing at the start.
Can I just go back, Mr. O'Connor, did you say these documents were prepared for the Prime Minister and Cabinet?
Yes, well, we'll hear evidence about it, but these were...
And this was number 28?
Yes.
So are we assuming that that data was missing in numbers 1 to 27 as well?
Well, I think, to be fair to Mr. Freegard, he may not know the answer, well, certainly doesn't know the answer to that question, but that, and in fact, I don't know whether we have a full set of these clips in evidence, but it's certainly something we can look at.
Extraordinary.
It is, though, is it not, Mr. Freegard, of a piece with the evidence we were looking at earlier about frantic activity in number 10, emails, jotting things down on pieces of paper. And I'm going to take you to another document now, which is an email from Dominic Cummings to two of the number 10 staff, expressing a degree of frustration about these types of matters. This is INQ 174715, please. And if we can pick up about halfway down where it says Tom Mark. So this is an email on the 25th of March, so a week or so later, just after the lockdown has been announced. He's talking about the dashboard. We'll come back to that, but it's the same sort of data, or types of data that we are discussing. He says the NHS numbers remain a mess. I look at the daily COBRA reports, I scribble down numbers. People say 815 or 915. I look back, none of them are consistent. I'm not going to read it all out. We cast our eyes down. We see he's trying to make sense of the reports. And then if we can go to the next page, please. He's talking about beds forecast to be free, so similar type of data that we noticed wasn't available. And then he says, no deaths, number reporting seems a shit show, different times every day. WTF use is a number for 9 a.m. that's then updated retrospectively. There should be a number calculated in a sensible way, done at the same time every day. It's intuitively sensible. This shouldn't be too much to ask of the NHS. And then, perhaps picking up on the same theme as observation by my lady a few minutes ago, I'm truly amazed that even after weeks, this most basic stuff is so hard for us to get our hands on. Am I being unreasonable? And if we can go straight to the response he gets, that's 48313, page 31, please. Well, you're ahead of me, thank you. No, you're not. And it's page 31. So we see, in fact, that the top half of the page is the last bit of that email, and then Tom Shinner replies, bottom half of the page, "You're not being unreasonable. It's a mess. It should be possible to fix all this." You'll see some of it tomorrow. He refers to deliberate obfuscation in the room and the boss letting MH, perhaps Matt Hancock and others, get away with throwing him a random graph with subtly different numbers none of us have seen. And so on. Thank you. So, both in the CRIP and perhaps in that exchange of emails, we see, at least in the outset, some very serious data availability, data handling problems in number 10.
And as I think the Dominic Cummings email shows as well, some of those issues that come from perhaps the same thing being recorded in different ways in different places and not being able to bring it together so easily. And the time and effort that it takes to come to that single version of the truth, when you should be having time to discuss the response to all of it, you're still arguing over the numbers to begin with.
Now, we saw that one of the recipients of that email from Dominic Cummings was Tom Shinner, and he was the person, or at least one of the people, responsible for developing the dashboard that you've referred to. And that was a product that was designed to do something very similar to the CRIP in terms of being, in your phrase, a single source of truth. But it was a very different type of product, was it not? Can you give us, just in a few sentences, we'll have a look at it in a moment, but tell us how it was different.
So certainly over time, a lot of the data pipelines became much more automated, so we avoid some of the problems that we've already discussed. It's much more visual as well, rather than just numbers in a table. We can see it brought to life in actually very clear charts and graphs as well. And I think some of the key issues around the caveats behind any data, the sources of the data, when it's updated, that becomes much more standardised and regular and clearly marked as well.
Just to emphasise the point about automation, and we'll come to it, but instead of it being a product of people receiving emails, spreadsheets, and manually populating tables, perhaps as the name dashboard suggests, this was an automated process where the information simply fed into the system and the graphs and so on were dynamically generated.
Yep, certainly much more automation.
Let's have a look, please. So it's INQ. Yeah. Now this was a first of all, it's an internal product for the use for use of the Prime Minister and other members of the government. Is that right?
Yes.
We see it's got COBRA at the top. The reason I mention it is that there was another, I think later, there was a public-facing dashboard which provided similar, albeit less detailed information to the world at large. But this is the internal government version of the product. Is that right?
Yes, that's right.
It was, I mean, we've described it as being dynamic. So it was updated, perhaps all the time, but certainly it would be possible to look at a different dashboard for every day. Is that right?
Yes, and across various different measures as well.
And we can see that the date here in small type is the 24th of March. This, in fact, I think was the very first. It was almost the prototype, and it was before it was actually being used. So it was, in fact, if you remember, the email between Dominic Cummings and Tom Shinner was, I think, the 25th of March. So this is around the time that the dashboard is being set up, and this is, as it were, a prototype. But as you say, we see immediately it's a very different sort of product, much more accessible. Can we go on and look, please, at pages 11, 12 and 13 in series. So there, in fact, as it happens, we see the way in which the dashboard presents the information which was missing from that CRIP, the number of ICU beds, how many are being used, therefore how many are available. And similar, if we can just scroll forward to pages 12 and 13, we see similar data relating to those matters.
How did they make the transition from the obviously inadequate CRIP to the dashboard and the automated populating, I think is the word, isn't it? Did they have the software available, or did they buy it as a matter of emergency? How did suddenly we make this transition?
My understanding is that they brought some more expertise into the centre, so people with sort of data science skills. I think there were a few private companies who may have brought software in as well that was able to, I think to begin with, patch together some of those various different sources that were coming in, and then over time develop those pipelines that were much more automated to bring the data through.
I'm sure we'll hear more evidence about this, Mr. Freegard, but it's fair to say that none of the things that happened in setting up the dashboard could only happen once the pandemic started. These were all things that could have been done in advance in readiness for a pandemic.
That's correct.
Just before we leave this, it's right, isn't it, that once this dashboard in fact became operational within a week or two of this date, over time it became much more sophisticated. I think when one prints off this document, it's 20 or so pages long. Certainly it doubled, trebled in size as the product became more sophisticated, more data was added to it during the course of the pandemic. Is that your understanding?
Yes, that's right. And as you suggested earlier as well, there became a public-facing version on a website which was much more interactive, very well sourced, lots of notes about how it was being put together, and allowed any member of the public to dive into the data in more detail.
Yeah. Thank you. Just following on from this, I want to ask you about just two of the other government initiatives during the pandemic to improve the use and sharing of data. There are a number that you mentioned in your report. I just want to ask you about two. First of all, what's known as number 10 DS. So if we can turn to page 19 of your report, paragraph 35C. Yes, so the DS stands for Data Science Team. Can you tell us a little about this initiative?
Yes, so this was an attempt to bring in people with sort of greater data science expertise and a sort of variety of skills around that to improve the use of data and analysis within Downing Street, so to make sure that the Prime Minister and the Cabinet were getting the best analysis they could, thinking about more innovative ways of using data to develop an even clearer picture, and I think as well ensuring that Downing Street had the data capability to hold other parts of government to account as well.
And I think it's right to say that at least one of the people who was responsible for this data science team was a man called Ben Warner. Is that right?
Yes, that's right. And there were other initiatives alongside this, such as JDAC, the Joint Data and Analysis sort of centre, which, again, fulfilled some similar roles.
Yes. I think it was one of the other addressees of that Dominic Cummings email was Mark Warner, who was Ben's brother. And they were both working alongside Dominic Cummings in number 10 at around this time. And Ben Warner it will be giving evidence to the inquiry in a couple of weeks' time. So that's the number 10 DS. On the next page, page 36. Sorry, no. On page 59, paragraph 36 of your report. I've got that right. Maybe I haven't. But in any event, yes, the establishment of the Joint Biosecurity Centre. Now, we heard something about this yesterday in the context of its jointness, the fact that it drew in expertise from not only England but the devolved nations as well. From a data angle, what was the significance of the Joint Biosecurity Centre?
So it was designed to be a sort of single analytical function on behalf of the sort of public health side of things, to bring together various different health data flows and be able to advise the Prime Minister and Cabinet and others based on that information.
Thank you. I want to move on, Mr. Freegard, and just touch on or sort of survey the different types of data set that were available to the government during the pandemic. And this is something that you explain at some length in your report. And in fact, several of these areas have been covered with Sir Paul Diamond this morning, which means we can take them very shortly. But if one classifies the various data sets, as I've said, there were very many of them as the pandemic progressed, were there not?
Yes, and of very different types as well.
Different types, some with sort of interesting sounding names like Siren and Vivaldi, others with less poetic descriptions. But in any event, many of them one might describe as testing and healthcare data sets, starting most obviously with, as you say, line data from hospitals, details of admission numbers, deaths, availability of ICU beds and so on. But also then, as the pandemic progressed, various prevalence studies, and those Sir Paul did discuss, including, of course, the ONS coronavirus infection survey, which the ONS ran itself, so we don't need to take time on that. But one of the other data sets relating to prevalence that you refer to in your report was wastewater data sets. Tell us something about that.
Yes, so again, a sort of innovative use of data from the JBC and later the UK Health Security Agency, where various sewage centres across the country, the water there was tested to understand if there were remnants of COVID, because obviously people infected with COVID would shed sort of samples in various different ways, wastewater being one of them, and that was used to indicate whether there might be a sort of rise in cases to be expected.
And did that enable presumably some sort of regional variation to be identified depending on where the testing was taking place?
Yes, that's right. I think it covered around 3/4 of England, I think I'm right in saying.
The other area of data sets that I wanted to pursue with you, which again we didn't get into with Sir Paul, was what you describe as non-health data. So leaving aside all of the studies about whether people had COVID or not and vaccines and deaths, these were a really rather different source of data that were nonetheless useful, were they not?
Yes, that's right.
Another term which is, I think, used to describe at least some of this type of data is mobility data.
Yes, so one of the data sources that was used, for example, by some of the groups modelling the reproduction number and other statistics, was Google mobility data. So this is where people with sort of Google on their phones have not disabled location on there, and that's able to give an indication of sort of where people are moving.
So just pausing there, nothing to do with searching for things on the internet, but Google also has this slightly less well-known function of knowing where you are.
That's right, and the sort of thing that enables people to see where they are on Google Maps and so on.
Yeah. So just go on. How was that used?
So that and various other big studies as well, such as Comics, Corsair, I think the Scottish Contact Survey as well, and also polling, were all used as indications of to what extent people were mixing, how many social contacts were they seeing, and that could be used as part of modelling the spread of the disease.
You also referred to telecommunications operators providing data of this nature. Was that also simply relating to mobility, or was that something else?
Yes, I think that tended to be the same purpose.
And it may be that we hear more from the modellers about this, but as well as being a factor that could feed into the R number, it's right, isn't it, that this data also provided an insight into the simple question of whether NPIs were working or not?
Yes, that's right.
So how much less movement around the country is there this week than there was last week?
Exactly.
It's also something you mentioned in your report that educational establishments, schools, universities fed in this type of data.
That's right. So again, some of the R modelling groups and others made use of school attendance data that the Department for Education got up and running, I think asking schools to fill in forms at the start, and then I think also automating that process as far as they could, again as an indicator to see how people were moving around, but also how many people might be absent with COVID.
Yes, thank you. I'm going to move now to a slightly separate subject, which is one of those subjects you were asked to address in your report, which is that of data sharing between the central UK government and the regions and local authorities in England. For this purpose, if we could go to page 44 of your report, please. It's paragraph 85. Yeah, thank you. The paragraph 85. Now, you say, Mr. Freegard, that the UK government was slow to share data with local government during the pandemic, with the result that many parts of local government in England did not have the data they needed at a sufficiently granular, you might mean level, to understand and combat the spread of COVID in their areas, even when some of those areas were entering local lockdowns. Although you then go on to say it was eventually shared, and there are some examples of innovation and so on. But just first of all, the first sentence of that paragraph, you refer to something that didn't happen as well as it might have done, the sharing down to local and regional levels. I want to just try and draw together some of the points you make in the rest of that page. And it seems, first of all, that one of the problems that you've identified is that local authorities were regarded as, your words, an afterthought in government planning, and that central government institutions lacked an understanding or a sufficient understanding of local government to facilitate sharing of this type.
Yes, that's right. I think afterthought is a quote from somebody we spoke to
Yes.
in local government, and I think they felt they hadn't been included in any of the planning processes. And again, we've seen the effects of not properly planning and thinking about this. As you say, there's also that sense they had that central government didn't necessarily understand what they might need data for, how they might need to use it, and the benefits that it might have for them. I think it's worth saying this is something that also happened before the pandemic. I've spoken to a lot of people in local government who are required to submit various types of data up to central government and often don't feel like they're able to make the most of it. It takes a very long time for it to come back to them, or it's very much a one-way relationship and they're not supplied with information that could be valuable to them in running their local areas at the best of times.
You also make the point that it isn't a straightforward thing to do for something called central government to share data with local authorities and regional authorities, precisely because those lower level, lower tier authorities are very various. They have different capabilities, different infrastructures, different maturity when it comes to dealing with data. And so it's actually quite a difficult process. It's not just a question of flicking a switch.
That's right, and again, it will be quite different for different data sets, data in different areas. As you say, there are different parts of local government with sort of different levels of data maturity in being able to use that. But I think even those that are very experienced in this sort of thing felt they weren't getting what they needed. And again, this is a sort of longer standing problem than just the pandemic. I think there is also a lot of overlapping jurisdictions. I think one of the reports I refer to in the annex, somebody said that at one point during the pandemic, they were asked to share data with a local resilience forum, to which their reply was, well, we'd be very happy to if we knew what one of those things was. I think there are, as you suggest, lots of different types of organisation, and again, understanding which of those needed what at what particular moments was quite difficult.
And then lastly, of these themes about problematic sharing, if we could just look, please, further down the page at 86C. This, you've referred to some of these problems being long-standing, Ms. Freegard, and emanations of difficulties that had existed before, but this point is specific to the pandemic, is it not? That these problems were, as it were, exacerbated by the government setting up, for example, the test and trace scheme independently of local public health authorities.
That's right. I mean, despite local government again would say that the funding cuts that they've experienced over the last decade or so has been a real problem in a lot of this. They still have a lot of expertise, including when it comes to sort of tracing the spread of disease. Things like test and trace being set up outside those existing systems and not building on that expertise created further problems.
There may, and it's going to be the subject of another module, so we won't get into it. But from there may be lots of good reasons to set up test and trace in the way that it was. But what you're saying here is that from a data point of view, it was in effect creating a new silo.
That's right.
Those are, I think, the key themes, negative themes, early problems. But it's right to say, as you indicated, or as recorded in that first paragraph, that things did get better during the pandemic and these problems were overcome to a greater or lesser extent.
There seem to be improvements. Again, it would probably vary with different data sets in different parts of the country, but I think some things were probably learnt from the earlier days. As new data came online, it may have been dealt with differently, and there were efforts from central government, particularly what is now the Department for Levelling Up, to sort of try and support others across the country.
I've just got two more areas I want to address with you, Ms. Freegard, and the first of those two is the question of data on race, inequality, disparities during the pandemic. And perhaps we can turn, for those purposes, to page 46 of the report, paragraph 89. And you say here, quite bluntly, that the system for capturing data around race, ethnicity and other characteristics was no more unified than any other data systems. So perhaps another way of saying it shared a lot of the problems we've been discussing for the last hour or so.
That's right, whether it was not collected as part of certain data sets or, again, whether there were inconsistencies in how it was collected. And I think there is also a definitional issue here, which is that often different ethnic minorities can be brought together under the same sort of data headings when actually the experience might be quite different for different groups.
Yeah. We have heard already a certain amount of evidence, of course, about the disproportionate impact of COVID on certain ethnic groups. We heard some evidence last week from a FEMO witness who emphasised the, as it were, almost immediate understanding amongst certainly healthcare workers of the disproportionate impact that black and ethnic minority healthcare workers were experiencing. And we saw correspondence from one of their organisations to Chris Whitty and other senior members of the sort of healthcare establishment, amongst other things, pointing to the lack of data, the urgent need for analysis and understanding of what exactly was going on. And it was you refer in your report at paragraph 90 to the PHE, the two PHE reports that then followed quite swiftly during 2020, addressing these matters. One, the disparities in the risk and outcomes of COVID-19, and then later the report entitled Understanding the Impact of COVID-19 on Black and Minority Ethnic Communities. So that was the process. But is it right, though, that in terms of data, both of those reports essentially concluded that there wasn't enough data, and that, albeit that no doubt they addressed other steps that could be taken in terms of the data, what was really needed was more?
Yes, that's right. And it's, again, something that I've heard from members of modelling groups as well, that they would have liked to have been able to have that detail to understand how the disease was affecting different communities. The PHE reports that you mentioned, again, talk about possible steps such as standardising definitions across different government data sets, thinking about making it mandatory on death certificates to record ethnicity, and various other steps around the data as well.
Yeah. And in terms of progression during the pandemic, we can see in this paragraph that's been highlighted, just the last sentence or so, you do refer to several of the early COVID-19 studies allowing for analysis of particular characteristics. And then you refer to the ONS, the CIS, Professor Diamond called it, the COVID infection survey, having some fields for occupation, ethnicity and deprivation. And then actually, if we can look further on at paragraph 91, please. You're referring here to the technical report produced by Chris Whitty and Patrick Valens. But they note, I'm picking up on the last few words of this page and we'll go on to the next. They note in the technical report that by the second wave, so later in 2020, the weekly COVID-19 surveillance report incorporated more disparities data, and then dropping down a line or two, from May 2021, so over a year after the start of the pandemic, the PHE were publishing what was known as the CHIME data, so COVID health disparities monitoring for England, which included reporting on disparities. Although you say that it, like several other data sets, didn't have access to underlying conditions. So the picture seems to be, Ms. Freegard, but tell me if I'm right, that this problem of inadequate data, even once the pandemic was well underway, even once the disparate effect was known and people were trying to do something about it, even as late as 2021, it seems there were still problems with these data sets.
Yes, that seems to be the case. And I was struck reading the technical reports. There's an entire chapter on some disparities, and it begins by saying that infectious disease outbreaks tend to exacerbate existing inequalities. And I think that does also, again, take us back to the questions about preparation and whether perhaps some of this could have been foreseen in terms of the demographic data that might be needed.
You fairly, though, identify in your report that there are particular difficulties, perhaps, sensitivities around this type of data. And so, for example, at paragraph 95, you refer, and again, this is a reference back to that part of the technical report that you were describing, the technical report itself stating that the data is sensitive and it was being asked of communities with relatively low trust in government organisations and understandable concerns about privacy and the use of their data.
Yes, and I think it's fair to say as well that the Public Health England publications and others recognise that and speak quite a lot about the importance of engaging the community.
And paragraph 96, you expand on a point you referred to earlier, which is calls by the Equality Hub, that a key lesson from the pandemic is that we shouldn't be treating ethnic minorities as a homogenous group and that the data needs to be more sophisticated.
Yes, that's right. And as you suggest, the Equality Hub, the Race Disparity Unit and others have started to do quite a bit of work on what that might actually look like in practice.
And then finally, for these purposes, paragraph 98, you go back to the technical report. And this does also bring us back to some of the evidence that Sir Paul Diamond was giving. First, noting that ethnicity recording on NHS systems is of poor quality. And then referring to reports from the Race Disparity Unit, their final report on addressing COVID-19 health inequalities, It says key lessons include improving the quality of health ethnicity data, so patterns and trends can be spotted more quickly, and continuing to monitor the impacts of COVID-19 by ethnic group. And their recommendations, just briefly going over the page, again, familiar points, at least some of them raised by Sir Paul Diamond. We see B, for example, the ONS is to collaborate with others to consider how linking census and health data could be improved. So that's the innovative, either innovative or experimental, depending on who you listen to, technique that he was describing, and a way of providing more robust ethnicity data and combining the census data with healthcare data to that end. Is that right?
That's right, yes.
And then also we see, dropping down 2 points, the issue, again, to which you referred, of collecting ethnicity on death certificates. I'm not sure you were in the room, but that, in fact, was something Sir Paul Diamond did not support. He was much keener on trying to obtain the data from NHS records.
Keep saying Sir Paul, I think it's Sir Ian.
I'm sorry.
Sorry. The stenographer has been reporting Sir Ian.
She might correct it. That was what I wanted to ask you on ethnicity data, and that just leads me to the last point, Mr. Freegard. You, at various points in your report, you describe the pandemic, despite the challenges that we've been discussing, as the high watermark for the use of data, the sharing of data. Perhaps it's obvious, but what do you mean by that?
So again, that's a quote from the Ministerial forward to the National Data Strategy. At that point, the minister was Oliver Dowden, who's now the Deputy Prime Minister. And he describes it as a high watermark because so many people in government who perhaps hadn't understood data or hadn't taken it seriously were suddenly very aware of the benefits that using it properly might have in combating the pandemic, whether that was in monitoring the spread or mitigating the effects.
And so perhaps precisely because they were responding to these challenges in a rush, and I think you describe it as mending the plumbing or something.
Fixing the plumbing.
Fixing the plumbing, but the imperative to make data work meant that it was used more broadly and understood better, perhaps, than it had been before.
That's right. Again, there was a very clear purpose. There was a real urgency to using data and improving some of the systems behind it to fight the pandemic.
The reason I ask you this is because of a second observation that you make at points in your report, which is that the risk now is, if you like, that the tide is going in, and that some of the advantages and forward steps that were taken during the pandemic are actually being lost.
That's right. Several public servants that I've spoken to have expressed their concern that without that urgency, without that problem that needed to be solved instantly, political attention might wander. Some of the barriers that were temporarily overcome may return to business as usual. I'm struck as well by, I know one piece of evidence from Professor Keeling where he looks at monkeypox experience.
Yes, well, I was going to ask you about that. So let's go, if we can, just the last document, to INQ 56476. As you say, Professor Keeling is an epidemiologist at the University of Warwick, who is in fact coming to give evidence later this week. What we're looking at is a response that he provided at an early stage of our own processes, a questionnaire response. But he does make an interesting observation, which we will ask him about when he comes, but let's ask you about it now. So if we can go to page 39, please, and perhaps zoom in on that whole of that paragraph number 2. So from the, he makes the point, which no doubt we will hear from him and his fellow modellers in due course, that models are only as good as the data that feeds into them, and modern models are often data hungry. There's then a section of this paragraph which I can summarise as him explaining that the data flow that they received from the NHS during the pandemic was not exactly as they would have wished. They were given some data, but not all. And then, importantly for our purposes, there's the passage starting, I had hoped that many of these difficulties. He says, and perhaps I should have said, we don't need to go back to it, but this questionnaire response was in fact dated September 2022, so a little over a year ago. He says, I had hoped that many of these difficulties would have been resolved for the monkeypox outbreak, which was going on at the time he wrote the questionnaire response. But if anything, the data access issues are worse. Admittedly, SAGE and SPI-M are not directly involved in monkeypox modelling, but the academic community has still been asked for its help. With monkeypox, the UK data is only available to UKHSA affiliated staff with a UKHSA laptop and is again siloed so that the entirety of the data sets are not available to all users. Does that perhaps provide a concrete example of the concern that you were expressing, that sort of spirit of the pandemic making data work not only hasn't been maintained but is perhaps regressing?
It does, yes. I think it comes back to a point we discussed earlier as well. I think it may be due to caution. Clearly, UKHSA wants to ensure that the data is not shared inappropriately. But we can see in this example it means that academics that could bring a huge amount of insight to it appear not to be able to access it.
Without asking you to solve the entire problems of data in government, what would be your immediate suggestions as to how we can stop these advantages gained over the pandemic being lost?
I think the meta answer, and it goes back to the very first set of questions, is learning from not just the pandemic, but looking at all of those different recommendations that have been made over the last few decades, understanding why those that have stuck, and why those that keep being made over and over again have not actually been successfully operationalised. I think we were talking about the Chief Data Officer earlier. I think having those sorts of leadership positions which are able to keep a focus on these sorts of issues and have the power and the levers to make a change, having those positions would be hugely helpful. We've seen already development in the civil service of sort of greater skills in all civil servants, not just those working in the data profession, so senior leaders as well, giving them a sense of data literacy. You don't need to know exactly how to write these algorithms and understand how to build these pipelines, but you need to have a sense of what is being done to do it and what can work and what can't. And I think just ensuring that these questions about data are built into the design of policies and operational systems from the start, to ensure that what we might need at some point will be available whenever it's built.
Thank you very much, Ms. Freegard. That's been very helpful. Maybe those are all my questions, and I don't believe there are any Rule 10 questions.
And listen to the voices in the wilderness, Mr. Freegard. I hope you don't feel as if you're like that, because certainly what you said has been extremely interesting. And I'm very sorry to hear that you think that we're not making the same kind of progress, or we're going back. The opposite, in fact, we're deteriorating again. I think that would be extraordinary.
I think it's worth saying there are definitely lots of initiatives going on at the moment, which I think give me more cause for hope. And there is now a generation who takes this really seriously because of what's happened. But hopefully the work of the inquiry will stop it sliding any further.
We'll do our very best. But just one last final question, therefore, for me. If a pandemic hit tomorrow, and I have been told in another module that it's not a question of if, but when, would we revert to the CRIP situation? Or would we have in place the ability to have the dashboard? In other words, do we have that capability still that could be put in place immediately? Because the CRIP thing seemed to me to be a complete waste of everyone's time.
I would very much hope the latter. I think the dashboard team and others who were supporting them did an excellent job, and I think, in a sense, that has become one of the success stories of the government response. If we can't learn from that, then I think we're in real trouble.
Thank you very much indeed.
Thank you.
Thank you. 10 o'clock tomorrow, please.
All rise.